Oh my God. He already starting, y'all. He already starting with the crying. I don't know what his problem is. I don't know. I don't know what he did. I don't know what he did. I don't know why he hurt himself. I don't know. I don't know. I just work here or live here. Whichever. 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 Let's see if anybody can hear me. Yeah. What's up? What's up? I don't know. I don't know what he's doing. He's Santiago. How are you, sir? Welcome. Today is Wednesday. Hopefully you had a good week this week so far. Hump day. Halfway through the week. Sorry if you guys hear my son back there. I don't know what his deal is. He's crying about something. He always crying about something. So, I mean, that's just him. That's just what he does. So, shout out to all of y'all. Hope everybody had a good week. I'm going to wait for everybody to jump up in here. And so my whole plan was to go over some NCLEX style questions. They were just going to be multiple choice style, but, based off of verbiage, that's what I was going to do. And thinking I can do it off of the computer, I don't got enough followers to do it off the computer. So I have to wait till I hit at least 3,000, followers on TikTok in order for me to start just chit-chatting through my computer. Like I got the camera set up. I even got the PowerPoint to go through all the questions, stuff like that. But, TikTok ain't trying to let me be great. So I can't use them. So anyways, shout out to all y'all. We got 14 people all up, that are already up in here. Going to be on the live for a little bit. Today is Wednesday. Welcome, welcome. If it is your first time, my name is Kevin. I go by the Boot Nurse on all social media platforms. Once you guys go over there and check that out, if you know anybody that may need this type of motivation or this type of, video for, NCLEX, nursing, anything related to nursing, you can check out my YouTube channel. It's at the Boot Nurse. And make sure you guys check out the website, thebootnurse.com. Got the 7-day NCLEX course over there that's in its pre-launch phase, as well as I got mentoring and coaching over there as well for anybody that may need it. So if you're new here, I want to know who you are, where you're from. And, I want to know where you are in your nursing journey. Like, are you new? Are you a new nurse? Are you, like you just graduated and you're a new grad, working in a hospital. Did you take your NCLEX? You starting prerequisites? What else? What else we got? What else do nurses do? Are you in nursing school? Like, what are you doing? Tell me. That way y'all can tell them who, and by them, I mean people that are in the chat. And, we can foster a really good conversation going on here. So, Senor Dil, it says, how long have you been a nurse? I've been a nurse for 3 years. Do you recommend taking out student loans while you're doing your prerequisites? I'm broke. Well, Amy, I personally did not use student loans. I was lucky enough to have gotten my school paid for because of my military service. So, I paid for it in more different ways than one. So, if you feel like you need to take out student loans, cool, do that. But there are tons of scholarships that are out there. I recommend going to nursing.org, looking at their resources and check out the scholarships that they have available, as well as looking into other programs. There are programs that are out there that will pay for you to go to nursing school. But the caveat to that is you have to go to where they say. So like if they say, hey, you need to go to, Podunk, Alabama, and take a chair with you, then that's what you got to do. No, I'm just playing. Hey, shout out. Oh my God, I got 100 people in here. Shout out. If I got 100 people in here, well, I only got 52 likes. Hey, make it happen. I love you. Anyway, so, so you got to look at those other scholarships. I want to say one is called like HPS, not HPSP. It's something along the lines of that, but it's like a government type of program that you can apply for. And it definitely, they'll pay for you to go to school, all of it. But it's just like you'll end up having to go somewhere. That they need for you to go, like a really underserved area, if that makes sense. So if you need student loans, cool. I mean, I'm not really one to tell anybody what to do with their money financially, but if you can avoid student loans, avoid them as much as possible. Unless you know that you have a plan like, hey, I'm going to be a nurse, I'm going to do this for a year, and then I'm going to go travel and make this travel nurse money where I can, stack the, get the bags and then turn around and pay your student loans off, because them student loans, they'll start to pile up real quick. I'm in nursing school, 1053, shout out to you. You're in nursing school? All right. Look up TCU nursing. Look up TCU nursing student first day. I don't know what that means. They get all this cool shit, and I got debt and debt. Yeah, that's kind of how it goes. Did you see about the Air Force nurse in Okinawa? Not a chair. Yes, the chair, because you already know what comes with that chair. A brawl. Let me stop. Anyways, are you talking about that girl who was in the I think she was in the NICU, and she was venting on social media about how she felt and giving them sugar and all that other nonsense? Is that what you're talking about, guy? I think that's what you're talking about. Let me know if that's what you were talking about. But yeah, like, well, you know, chit chat, talking about all kinds of stuff. I got 48 people up in here. Shout out to y'all for being in here. Yeah, her. So I did see that. I actually follow Disgruntled Docs. I actually was on Disgruntled Docs podcast. You can go over there and check that out. And of course, you know, it says my lovely name, the Boot Nurse, and Kevin and all that over there. But I did see what she put. And then she got online and said something and apologized and all this other stuff. This is just a huge warning to everybody. It's just like, just because you post it on social media doesn't mean that you're safe. You leave a digital footprint or a fingerprint or whatever, and that's it. That's it for you. So don't think just because you post on social media, you can just do what you want. Don't be going out there venting. And then on top of that, she worked in, I believe, a NICU where, you know, you have the most sick babies that are out there. You see what I'm saying? And then you're talking about how, you know, you can't stand these babies. Like, Like, I don't know if everybody remembers what happened on Snapchat. I believe it was on Snapchat where there was girls that were working, I believe in pediatrics, and they were saying all kinds of stupid shit about this child. And then, of course, they got all over social media, and they got all the way up to the biggest portions of the Navy. And you never heard about those girls ever again because of the stupidity that they thought that they could just do, especially when you're working in a hospital or in a professional environment on top of being in the military. Make it make sense. So I did hear about her. It's not going to look good for her. It doesn't matter if she apologizes or not. She let her emotions get the best of her, and she put it all out there on social media for other people to interpret how she felt. Doesn't matter. She should have kept her mouth closed, or she should at least vented to somebody about how she felt rather than put it on social media. But then again, you shouldn't be talking about that about anybody's kids. They're in the NICU, and that's where you're at. I don't care if you've been working there for 20 years. You don't do that. Army wife, what up? Shout out to you. Any advice about the new generation NCLEX? I'm getting ready to take the RN, and I'm so scared. Is that Stangal? Like for Mustang Gal? Well, Stangal, my advice is to, and I say this every single time, if you've never been here, welcome to the channel. But the one thing I'll tell you is, first thing, you need to recreate the testing center. So you don't need to be, if you need to be studying, why you on here looking at me? No, I appreciate you looking at me. Keep doing that. But recreate the testing center. Get rid of all distractions. Understand your content. Understand your NCLEX style questions. What are they asking you? If you don't know a specific subject, so pharmacology is a hard spot for you, I recommend studying there, like starting there and then working towards those other areas that you may be okay at. Start with the hardest stuff first, and then it starts to get easier. Practice, practice, practice. So if you're doing content, do content, then do questions and answers, and then do, read and review all your right answers and your incorrect answers, and then rinse and repeat. Give yourself a break because, this is a muscle. So you got to give yourself time to relax, all that good stuff. And, cut people out. Because remember, on that degree, it doesn't say no one else's name but yours, right? Your license is only going to say your name. So I'm just saying, hopefully that helps you. I'm a pre-nursing. I am so scared. I'm not smart enough. Is that Shanty? Is it Shanty? Shanty-I? What you got to be scared of? You got to be scared that you're already doubting yourself. So you already doubt yourself. Put it this way. If you're already in a negative mindset, you're destined to fail. So you need to pull out all those thoughts, and then you need to think to yourself, is this the worst thing that could happen to me today? What's the worst thing that could happen to you today? It's probably unalive. Yeah, you're right. Absolutely. I didn't see what you just said, but I'm just keeping it all the way real. So you have to foster a different mindset, and you have to foster a different mindset, and you have to keep the positivity. You're the average of the 5 people that you hang out with. That's all I'm saying. So change the 5 people that you hang out with, change your environment, change your mindset. Thoughts on nursing, thoughts on nurses that go live on TikTok while at work. I don't really care, to be honest, as long as it doesn't impede you doing your job. But sometimes it's cringy. Sometimes it's not. Sometimes where I see people that are just we lost a patient today, and then they're sitting there and they're, acting all emotional. I was just like, no one has the time to do that stupid shit. You know what I mean? That kind of stuff is stupid. But, if they're funny TikToks, some of them TikToks are really fucking funny. So, but, hospitals have policies and stuff now. So Joanna, yeah, go look her up. Go look up the Air Force girl in Okinawa when she was in NICU and what all the stupid stuff she said. So I need a break. Well, take a break. It's okay for you to do that. Hello, any advice for new grads regarding applying for jobs? I would look up a multitude of questions in regards to ask them. So, well, I would say definitely go in there prepared. Definitely tell them what you want, what you need. And then at the end, a lot of them always tell you what their expectations are of you because you're an employee. Well, the same thing could happen as if you ask them or you tell them what your expectations are for them as a leader. You can do that as well. So is just go there, just be confident, be okay. Hopefully it's a good fit for you. And if you don't get the job, don't give up. Like, don't quit, like, at all, because the reality is like there's a lot of jobs out here for you to get as a nurse. Okay. What's it? I purchased Archer. Archer's pretty good. I did 125 questions a day when I practiced, passed first try. You got this. Facts. What else? Are paramedics to RN Bridges programs worth it? I don't know, Damien. For you specifically, since you're a paramedic, you'll go into an RN program with a lot of medical knowledge, or you'll go into the RN program with just a lot of knowledge in medicine, period. But the way that RNs, nurses do things are just very, very different. So it's for people that have a lot of medical experience, it's either you're going to do really well or you're not, because you're going to go against the grain and you're going to create a headache for yourself because you're going to think that you know better based off of what you've experienced in the world. So it could be worth it, but it's only worth it as if you want to be a nurse. If you don't want to be a nurse, then don't do it. So Queen said, email me for your nursing degree. I don't know what that means. I don't know what you mean, Queen. No quitting, guys. Yep, we don't quit around here. I just started my RN program on Monday, and it already has me like, yep. Hey, Amber, I'm just letting you know, like, if it got you like that, just wait till you get to the end, because you're going to get to the end, because that's just what we're about. We don't quit around here, straight up. So, yep, sometimes what's done in real life isn't really how it's done in the textbook. No, that's a 100% fact. It's just like, because in the textbook, everything is perfect world. You have this perfect scenario. You have everything, you have the order, you have the help. But in reality, us that are working as nurses, or if you've worked in any type of a medical environment, you ain't got all that, So, I mean, and there's different ways to skin a cat. There's different habits that you've adopted. So it all just depends. It all really just depends on whatever you have. It all just depends on you. I can tell you right now that if you're a paramedic trying to go into an RN program, or even an LVN trying to go into an RN program, you essentially kind of have to unlearn everything that you have learned while you're being in the real world and go back to being a student, because that's exactly what it is. So that was a good question. Tips for the T's. There's a really good book that I used when I was studying for T's, even though I didn't take it. It's the Mometrics book, the yellow one, and it is on Amazon. I think it's going for like $33. So I would definitely check that one out. But I'll shout out to all 19 of y'all. Man, I had like 100 people up here. I don't know what happened to them. Bring them all back. Anyways, welcome to the stream. Welcome to TikTok Live. If you have never been here before, my name is Kevin. I go by the Boot Nurse. I've been a nurse for 3 years, a little over 3 years. And I've worked in 3 different places. So I've worked in the ICU, I've worked in PACU, and I've worked in the operating room. So, for 3 years of me, being a nurse, I feel like I'm a little well-rounded. I'm not perfect at everything, and I don't know everything by any means, but I definitely realize what I like and what I don't like. So nice. How did you like it? How did I like what, Joanna? What part? The textbook hospital med setting is euphoric. Real life in hospital, the shit gets real. Facts. Can you talk about nursing in the Navy and the dynamic between corpsmen and nurses? I can. So the dynamic between the nurses and the corpsmen is like, there are a lot of things that corpsmen can do, or a lot of things that corpsmen do that nurses don't. So, for example, like when the corpsmen will be with Marine Corps units and they're the only medical personnel or provider for, a platoon or a squad or whatever for Marines. There's a lot of things that corpsmen can do based off of a nurse's license, because obviously they work directly under him. So, depending on whatever's going on, corpsmen can push IV meds. LVNs technically can't do that unless they're IV certified. But, it's like the knowledge, like the dynamic is really not that big, except for the fact that a nurse is a nurse and a corpsman is a corpsman. It's the level of education. Not saying that a corpsman's not smart, but there are a lot of things that corpsmen are not exposed to that nurses are when it comes to the how versus the why, if that makes sense. So there is a dynamic there. But I have worked in units where, there's brand new nurses and, they don't know how to do anything, because they're boot baby nurses. So, there's a saying that we say in the Navy is that the corpsmen teach the nurses, right? But then, it depends on what level of a corpsman that you are. We have IDCs that are corpsmen or sub IDCs or, search and rescue corpsmen or all the other stuff. And they have a wide variety of knowledge that I've seen put a lot of nurses to shame. But it all just depends on what you do. Your experience may vary, right? So let's see what else is going on. What did you ask me? What would you do instead? What would I have done instead of nursing? I mean, right now I really do enjoy digital marketing. Honestly, that's what I would do right now. That if I wasn't doing nursing, because I find that actually pretty fascinating. I didn't necessarily think I was a numbers guy, but I like numbers. But then I also understand like what people like, kind of thing. So. The ICU, did you like it? The ICU was, so I love the training that I got in the ICU. I love the knowledge. I'm sorry, let me take that back. I loved everything that you could acquire and learn while you were in the ICU. When I worked at the burn ICU, I loved it. The training was great. When I started working in a medical and neuro ICU, kind of got thrown to the wolves, and it was during the second wave of COVID. And I did not have a good time. It was not a good time to have been thrown into that. I mean, but I did it. I did it for like 7 or 8 months there. And I did the burn ICU for about 6 months. So I have like a year and some change, of ICU experience. I go up to the ICU almost daily now, doing other things like with infection control and prevention. And then I miss it when I go up there. I'm like, man, I miss it up here and I miss y'all. And then next thing you know, some other stupid stuff starts happening. I'm like, yeah, I gotta go. So, I mean, it was cool for what it was. On subs, it's just is it just corpsmen or do they have doctors or nurses as well? So on subs, it's usually just a corpsman, like an IDC. Are any of the units you worked on the one you wanted to do in nursing school? Yes, I wanted to work in the ICU. And I worked in the ICU for a year, but honestly, I got burnt out and I got tired of it. I didn't like the unsafe patient-nurse ratios. I didn't like the lack of support and a lot of the training that didn't come along with that. So, what's up, Hannah? Welcome, welcome, welcome. Shout out. I think I caught up on everybody's questions. So I was waiting for people to come up in here, but we're going to see how everybody's doing. Shout out to all 17 of y'all for jumping up in here. If you are new here, welcome to the stream or the TikTok, whatever you want to call it. My name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys check that out. Another little thing about me that people don't know is that I am a Navy instructor, and I've been an instructor / educator since 2015. So what that makes 8 years. And I've taught in different programs like surgical technology. I've taught TCCC or tactical combat casualty care. I'm a trauma nurse instructor. I taught pre-hospital trauma. I've taught a whole ACLS, BLS. I've taught a whole bunch of classes, a whole bunch of other different courses. So one of my biggest things that I love to do is I love to teach. And that's exactly another reason why I start to do these TikToks. So I thoroughly enjoy it. So that's just a little bit about me, but I want to know a lot about y'all. I want to know who you are, where you're from, where you're at in your nursing career, your nursing journey. So are you a new nurse, pre-nursing student, nursing student? Like where you at? Are you about to start school, first time starting school? Are you a nurse that's already been out there working? All that good stuff. Do you have PTSD for COVID nursing? I know I do. I do, actually, 100%. I'll give you an example. There was a patient. I was walking around doing bundle checks, right? And if you guys don't know what bundle checks are, we're checking like invasive devices such as Foley catheters, central lines, PICC lines, midlines, all that good stuff. Matilda, what's up? So I'm going around checking, asking all these questions, and for infection prevention. And when you're in the ICU or when you're in the hospital, for all those new nurses that don't know, you start to get this intuition and you start to just feel it. You're just like the air tastes funny. Like, something weird is about to happen. And so I start listening and I'm looking and I'm just like, I don't like the way that feels. So I'm looking around and then there's somebody that's next to us and I can see the EKG from where I was sitting. And the guy was like in his not 60s. Like he was, his heart rate was like in the mid 60s or something like that. And then next thing you know, I turn around and he bradyed down. And of course, we're talking about bradycardia. He went from 60s to like the low 40s, right? And so there should be no reason why there's a drastic drop like that, right? And so you're like, hey, if it drops more than 20, you might want to be like, what's going on here, right? And so I'm just like, that doesn't look good. So first thing I'm like, well, he's bradying, man, he might need atropine. We got to bring that heart rate back up, blah, 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 right? And I'm like, that doesn't look good. Next thing you know, I was just like, why do I feel like somebody's about to grab the crash cart? Somebody grabbed the crash cart, because that's exactly what I would have did. And somebody grabbed the crash cart. And as I was sitting there, I walk out of the room and I start to feel this tingling in my chest, and then I start to feel it in my neck. And then there's a student that's there. And she's asking me, and she's just like, well, what's going on? I was just like, oh, there's probably about to be a code. And she was just like, what makes you think that? I was like, well, the air tastes funny. And she was like, what? I was like, yeah, think about it. Like, his heart rate is dropping to like, it went to 40. I was like, this is going on. And this is ding dong, ding dong. It hadn't been 15 seconds. And next thing you know, there's code blue. And I'm just like, And in my head, I'm like, my PTSD. And I was just like, well, there's that, right? And so next thing you know, of course, everybody's running in there doing everything that they're doing. And, before I know it, within like 45 seconds, the room is filled with like fucking 15 people, right? So as I'm saying that, I'm just like, yeah, I got to go. And so I walked out and I was just like, yeah, I can't be back up here. Like, it's just not my vibe no more. It's not my scene. So to answer your question, yes, that's what COVID did to me. And I'm not a fan of it no more. So there's that. Starting my third semester next week, I need this vacation to keep going. Look, if you want that real vacation, better get that license. That's when the real vacation comes. It says, Dion, I'm doing my prerequisites. It's so hard to get accepted to a nursing program. You're right. It is so hard to get accepted to a nursing program, but it's not impossible, right? So all you got to do is keep pushing. Keep pushing and keep doing you. Matilda said, good to be here. I'm glad you're here, Matilda. Is that Davina? It says, hello, can you please explain how CNAs can become BSNs? Going to school. You got to go to school to be a BSN. You got to do your prerequisites or look up the schools. You got to do the prerequisites. You got to get accepted to the school. And of course, go through the nursing program and all that good stuff. So I've seen, what is an hour and 20 seconds recently, asymptomatic, and no one seemed to be concerned. Wait, what are you talking about? I've seen what? You've seen what? Yes, it's definitely real. COVID nursing did something to me. It really did. I passed my T's on the third try. Good. That's what's up. Would that affect into? No, it won't. No one cares. No one cares how many times you failed it. They just want to know that you passed it. I'm ready to leave bedside. CG bedside is ghetto, ain't it? I'm just keeping it all the way real. Shout out to all 30 y'all up in here. I'm just saying bedside can be kind of ghetto. And so in the end, you have got to go where you are the most comfortable, where you can take care of yourself mentally, right? Because I'm telling you right now it's just like, I don't want nothing to do bedside. But now I help with infection prevention every so often. So I go around and I, do all those checks and, do a lot of education because I love to teach. So, that's my realm. That's me. So what unit are you working on now? I work in the operating room. The heart rate was asymptomatic, or the heart rate was asymptomatic. Yeah, families are the worst. You got to think. So here's the thing that I've learned about families. It's just like, some families don't want to let go. Some families are very, very selfish, in my opinion. It's just like, you do everything that you can for her. And I'm just like, well, if somebody has a laundry list of problems, there's only so much that I can do for them. And there's only so much that we in the facility can do for them. It happens. It happens. I've seen a family wanted to keep somebody intubated for 6 weeks. And I'm like, you want to what? So, there's a lot of unethical things that happen. I was like, why are we still doing this? Because, some people can be selfish. However, I do understand, that's your loved one. That's the one that you have a relationship with. Like, I get it. But I think me as a nurse, I think I have a better understanding. Most people that are in medicine have a better understanding about when to let go and when to not let people suffer, so on and so forth, So families can be the worst. I had one guy try to fight me and try to fight another dude. And I was like, I talked about that on Monday and I'm like, well, this isn't cool. Does that pay decent? Does what pay decent? I'm new in the ICU. I'm a new grad in the ICU. It's been decent just despite working nights. So every ICU is different, even if the ICU is the same, if that makes sense. So you could be in a medical ICU, in this state and then do another medical ICU in another state. Your experience will differ. Like, seriously, I've seen some people, there'd be nothing going on in the ICU and it's just too much. It's too much. It's knowledge overload that's happening, time management overload that's happening. And it's just not for them because it's going too fast. Me, I wanted that. And then I got that. And then I was doing that. And then I was just like, I don't want to do that no more. That's just what happened for me. But like I said, your experience will differ. And like I said, and this isn't me to shy anybody away from the ICU. Like the ICU is a great spot for you to learn. Critical care is the top of the top, in my opinion. Like, it doesn't matter exactly what you're doing. Like, cardiovascular, surgical, trauma, neuro, NICU, or NICU, PICU. Like, I respect all of that, It's just like, if it's not for you, it's not for you. And if it's decent for you, you work in nights. I can't do nights no more. That's another thing that just really messed with my head. But if it's good for you, Apple user 24, yada, 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 then cool. Then I implore you. That's a good word, right? I implore you to stay there. I want to do hospice. Go to do hospice. I have a friend that does hospice and she balls out of control, makes like $120,000 a year and then complains to me. And I'm like, what you complaining to me about? Girl, you better go get that stuff. So shout out to all 22 of y'all up in here. Hey, make sure y'all smash that like button. Y'all can't just be sitting here listening to me talk and not like me. Okay. And make sure you go follow me because that really tells me that you like me too. Okay. There. What do you do or what do you like about nursing, bedside job security? No, because here's the one thing about bedside nursing. It'll never go away ever. It will never, ever, ever go away ever. So if I ever was like, you know what, I want to dabble back in bedside and then I do it and I'm just like, nah, it's not fair for me. And then if I go away for a year and then come back and I want to do it, it's still going to be there. So it's not really, the job security is cool, but you can create your own job security as well. So, but like I said, bedside nursing is never going to go away, ever. Are you fully removed from bedside? Kind of, sort of, not really. But we'll see what the future brings for me. The patient he was just sleeping. Oh, of course he was. Does infection prevention pay good? Oh, I got you. So I'm just helping them out, every so often, but I'm not officially I don't have an infection prevention, clinical outcome role, if that makes sense. But I'm working with them and I'm just like, I kind of like this. So I'm just saying, I cannot wait to be done. Too stressful. Was it Darley? What you talking about? What you mean? Trying to be done with what? I'm having trouble passing my NCLEX RN. Should I do a CNA program in the meantime? No. Why would you do that? Because all you're going to do is it KT? All you're going to do is prolong what you're trying to do, what you need to do. And I don't tell people what they need to do. I usually suggest, because by me telling you what you need to do, it makes it a true statement. I have no idea what's going on with you. However, study, sit that ass down, get a program, and give yourself 30 days to 60 days, sit that ass down in front of a computer and study. Cut people off. Recreate the testing center. Study content. Apply the content to NCLEX style questions. Practice the questions. Remediate and review your questions. Rinse and repeat. Cut everybody off. That's what you need to do for yourself. You don't need to be like, oh, should I do the CNA program in the meantime? Why? When you could be focusing that time towards getting your license, because that's what you went to school for. Don't play with me. We like you. Calm down. What you mean? Oh, yeah, I know. Look, don't do that. Want to ultimately be in L&D, but I work in PCU as a CNA. I'm conflicted if I want to work PCU 1 year before. Well, if you like PCU, so here's the thing about being a nurse, or here's the thing about doing anything medicine, period, is that if you don't like it, you can move. Or you could go somewhere and try something different. Like the opportunities are always there. A lot of people feel like, oh, I'm stuck and I'm conflicted because, I feel like I want to do this, but I feel like I can't. But you can. The opportunities are out there. You really, honestly, just have to look for them. Honestly, for the skills. Oh, 1 year before the skills. But how much do you think I would need it? L&D felt like another world. So in my opinion, like, is it Alondra? Like, if you're trying to go to nursing school, I would most definitely probably stay in PCU. That way you can get more of those skills. But I mean, you're going to end up going to labor and delivery anywhere when you're in school. So Harper, you're in infection prevention. Hey, I like infection prevention. It's actually pretty cool. I'm actually learning a lot, and I don't even work there with them. So this is Hudson from the other day I passed. Hey, shout out to you, Hudson. Everybody give Hudson some love right now. Everybody give Hudson some love and let Hudson know that everybody's proud of her. Whatever positive things you guys want to say to Hudson. I just 24 people in here. Y'all make it happen. Give Hudson some love and tell her to welcome to the shit show. Welcome to what we call nursing. Hey, so here's the question for you. Did you go RN or LPN? I can't remember. Please remind us. And at that point, it don't even matter. I'll understand. I'm already a student. I feel like I can transition easy, but I feel like it might be too much. Well, so sometimes you got to take some things in stride. You really just got to realize that some things are going to come faster. You have to kind of accept them for what they are. However, if you get into a point to where it's a lot of uncomfortability and things are unsafe, I would definitely reevaluate some things. Okay. Yeah. Congratulations to you. Welcome to nursing. K-Tree, that could be you. I'm just saying, that could be you. Shout out to all 32 of y'all that are hanging out here with me, listening to me run my mouth. Hey, that's what I'm talking about, LPN. Okay, all right. I've already passed the bridge exam into RN. I'm only 19, and I'm taking my prereqs right now. Shout out to you. Hey, I don't know if everybody see that article about that 16-year-old girl who got her bachelor's degree from Arizona State? I'm just saying, it's doable. You got a 16-year-old who got her bachelor's. Got her bachelor's in nursing. So that should tell me age has nothing to do with it. Yeah, really, 16. Like, you can actually you can either go to nurse.org or just Google it. Put 16-year-old graduates or 16-year-old nurse from ASU and watch it pop right up. LOL, all good. We just chatting while I wash my makeup. Okay. Wash the makeup brushes. Get that nastiness off them brushes. I may have seen that process once or twice. I'm struggling with my NREMT. I mean, if you're struggling with your NREMT, like, what are you doing? What are you doing to fix it? What exactly are you struggling at? I mean, we're not really talking about NREMT. We're not talking about NREMT. However, I was an NAEMT instructor for TCCC and for PHTLS and some other ones. But what are you struggling on? Did y'all hear about the While I Wash crazy NICU nurse in the UK? Yes. So there was that nurse that was in the UK that apparently unalived, and I don't want to say the D word, and I don't even like saying unalive, but 7 babies. 7, y'all. Somebody who is supposed to be, what's up, Amber? Oh, that's my other corrections, right? My other one who wants to throw hands. I got 2 corrections folks up here that like to fight folks. I'm just saying. I got two bodyguards straight up. Somebody got filtered out. I don't know what y'all said. But yeah, I did hear about that nurse. You guys can if you guys don't follow me on Instagram either, I actually post a lot of stuff from nurse.org because they give a lot of information within the nursing realm. All those articles are written by nurses for nurses, which is awesome. So what does it say? It's just like, I got the job as a CNA at my jail. Okay. They're paying for me to go to school to get my license, and I start in October. Hey, look at you, girl. That's what I'm talking about. Yes, 7. Throw them hands for real. Hey, I'm just saying, look, I don't fight. Got fisticuffs, right? I don't fight. No, but seriously, hey, shout out to them, like, paying for you to go to nursing school. Do you owe them anything? Like, do you owe them anything at the afterwards? Like, do you owe them, like, oh, yeah, you got to come work in corrections for like a year or whatever to pay them back? Or because there's always a stipulation. There's always a stipulation of some way, shape, or form when these people Yes, I said these people when they are paying for you to go to school. So I'm just saying. But anyways, shout out to all 32, 33, 31. You know, it doesn't matter. Shout out to all y'all that are in here. Hey, I got 500 likes. I need 1,000 likes right now. Amber, I'm gonna need for you to get in people's face and be like, hey, yo, give them 1,000 likes right now. Hey, last stream, I had like 21,000 likes. Like, that was crazy. That's the most that I've ever gotten. So shout out to all y'all who, love me. Yay. Anyways, but shout out to all y'all. If you are new here, welcome to TikTok Live. I am your wonderful host, Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check those out. If you're a brand new nurse about to start nursing school, check out the 7-day NCLEX course. That link is in my bio. Hey, I'm just saying, get a jump on that right now before you go and spend hundreds of dollars on another program. Definitely check out this one. This one right here is being built specifically for nursing students and nursing grads, either be an RN or an LPN. Go check it out. I'm building it right now. By the time you graduate, the whole thing's going to be there, and you would have gotten it for $48, which is 80% off. Right. So, and once you get it, you have it forever. At some point, me doing that is going to change. But if you get it now, you get it forever, and you get all the updates that come with that. So make sure you guys go over there and check that out. But if you're a brand new nurse, I want to know who you are, where you're from, where you're at in your nursing journey. One of my co-hosts has just jumped in here, or she hasn't jumped in here. She's been in here. We got Army nurse, Army RN. She down there, Army wife. She's been a nurse for a while. She don't do bedside no more because she told me bedside is ghetto. She will essentially answer any question that I can't answer because there's a lot of stuff that's going on in here. There's 28 of y'all. There's one of me, probably another one of me somewhere because I got a doppelganger and it's not Jason Derulo. And but yeah, if you're a new nurse, I want to know all those things. Drop them down in the comments and let's have a conversation. I also decided that I was going to write up some NCLEX style questions. Now, the one issue that I had is that I cannot do it from my computer because I don't have 3,000 followers. And you want to know whose fault that is? Y'all's. Because apparently y'all don't love me. So I'm going to need for y'all to start loving me. And we're getting real. Hey, look. Brandon, I'm going to need for y'all to go find somebody. I don't care who they are. And they just need to follow me. Follow me for my antics. I'm just saying. I got old man eyes. I'm tired. I'm sleepy all the time. Your boy always working. Make it happen. Okay? Thanks. All right. So what we got going on? Let's see. Oh, man. Y'all done said a whole lot. Let us see what's going on. Throwing hands. Let's see. It's a 2-year contract. Okay. But I've been in the jail for 5 years, so commitment isn't a problem. Hey, things change every day. I'm just saying. Yeah, I learned it's a big bonus to join. Run facts. Hey, I'm saying sometimes that money. Hey, like somebody told me when I talked about the nursing strike that's going on right now in New Jersey and the nursing strikes that are going to be happening in Oregon, California, and Washington State. Hint, hint. Not all money is good money. I beg to differ. Give Kev all the likes. That's what I'm saying, Amber. Let him know. I'm an RT thinking about going to nursing school to become an RN. I'm just saying, if you're an RT thinking about going to nursing school to be an RN, the ICU definitely would be, I think the ICU would definitely be a good realm for you because you already know a big part of it, which is the vent. That's a very big part that a lot of nurses, depending on where they work at, they stray away from. Like me, especially with COVID, I wanted to learn about it, but it was a lot. Once I learned about perfect hats, if you can understand about what perfect hats, the low pressure and the high pressure, FiO2 and the PEEP, like as the baseline, yo, you're Gucci. You are Gucci out there. Hi, Kevin. I have a question. I recently just took the T's and got a 79. I was wondering, do you suggest retaking the T's? What was the score? Like what is it for the T's? What is like the scoring? I never took it. I studied for it, but I don't know what the scoring avenue is. And if you got a 79 and if it's passing, who cares? You don't need to. Like me, I failed my first time I took the HESI. I failed it. I got like a 74. You needed a 75. The second, and I didn't even study for it. And that was my own fault. And so the second time when I took it, I got like a 90 something. And I was like, oh, okay, whatever, With the T's, it depends what percentage the school wants. That's true. May I ask how old you are? Joanna, how old do I look? And let's not talk about the old man eyes. I'm just saying. Go Jersey. I don't know what that means. Like, what does that mean? Go Jersey. All money isn't good money. That's facts. C's get degrees. Sorry. Hey, I'm just saying There's people that look, if you get, what do you call a doctor that finished last in his class? A doctor. Ain't nobody going to know that unless he just is like, hey, yeah, I got the lowest grades in school, but I passed. Ain't nobody going to care about that. I took it in the school 1 to 50. Okay, I got you. 31, 32, 32, period. 32, period? Or am I period? Or am I a period? I don't know what's going on right now. But you were talking about the strike. Yes, I was talking about the strike. And that strike, to my knowledge, is still going on. And I just know from an OR nurse's standpoint, they were paying from a nursing standpoint, they were paying anywhere towards $110 to $120 an hour. I did that math. And I want to say for 18 days, you would have made like $12,000 or almost 15 grand to work for 18 days. And you probably would have got 2 days off. You would have worked 6 days a week, 12 hours a day. Yup. Yes, you would have. No, I'm not 31, and no, I'm not 32. No, I am neither one of those ages. So I think what I'm going to do, I'm going to try to figure this out. But my computer screen is way too big. So I'm going to try something. We'll see if this works. We'll see if this works. I don't know where my other co-host is, Nurse Nelly. She usually is up in here and she's like running the show and like answering all the questions and all that good stuff. But she's kind of MIA. She's going to be like, oh my God, why didn't you tell me you were on TikTok Live? You know I'm on TikTok Live all the time. You're playing games with me. So those strike hours are bananas. Yeah, bananas. BANANAS. Straight up. On that Gwen Stefani shit. Y'all see what I'm talking about. I'm just keeping it real. A lot of those strikes and a lot of those crisis assignments are exactly like that. Obviously, they're temporary. Hey, I just want to know. Bedside can be ghetto, but how ghetto is $120 an hour? Right? You see what I'm saying? Where are you located? Is it the same place you went to school? No. Obviously, you can see that's where I went to school. Funny thing about this stole, I didn't get this until about a week after I graduated. But that's kind of my fault because I ordered it late. But, you know, whatever. It's nice. It's nice, right? So I went to Texas A&M in Corpus Christi, and I do not live in Corpus Christi. I would not wish my worst enemy to live there because, you know, why not? Who wants to live in Corpus? Not I. Not me, ma'am. Just saying. I can't see what school it is. So it says TAMUCC, so which stands for Texas A&M in Corpus Christi. So, yo, I did a crisis contract. It's short and quick with an end date. Yep, that's true. Because usually crisis assignments can be what? Anywhere from like 2 weeks, 4 weeks, something like that. I don't know why. I mean, I don't know. I feel like if I say something like I'm going to get trapped into like a question, like I plead the fifth. You know what I mean? So, I don't know. Are you still in Texas? Yes, Joanna, I am in Texas. I am in good old Texas, a.k.a. The greatest country on the planet. Go Cowboys. I don't want to hear nothing that none of y'all got to say about that. Just smash that like button and just agree, okay? Thank you. Thank you, thank you, thank you. All right, let's see. Let's see. Who wants an NCLEX style question? Who wants one? Who wants one? 49ers. Hey, first of all, I'm gonna need for you to see yourself out, okay? I'm gonna need for you to see yourself out right now. The 49ers. Sir, we coming in here with the nonsense, okay? So, like I said, I had the PowerPoint and everything. No, it's all good. You good. No, but like I said, I have a PowerPoint and everything right here for the NCLEX style question. So the only thing that I'm going to do is I'm just going to read them, and you guys will just let me know A, B, C, or D down in the comments. And then once I give people ample time to go through that, I'll go on the back end and we'll talk about what the answer is. And I'll even give you the rationale why the answer was right. I think we'll like that, right? All right. So if nobody objects to an NCLEX style question, shout out to all 17 of y'all here. I'm going to read it. All right, here we go. A nurse is caring for multiple patients in a busy med-surg unit. The nurse needs to prioritize patient care tasks. Which patient should the nurse attend to first? Now, before I go on, what's important? What was one of the most important words in that entire question? What is it? What is it? What is it? What is it? First. Yes, it's first. Yeah, right? So what should that tell me? If based off of its first, it's like who's going to die first, right? Who's going to unalive first or expire or factory reset, whatever you want to call it. Those words will not be inside the NCLEX. And if it was, I would literally laugh my ass off. But so it's first, right? So who's priority, right? Who I'll see first. So the first one, we'll start with this. All right. So A, a patient with diabetes requesting a blood sugar check after lunch. B, a patient who just returned from surgery and is experiencing post-operative pain. C, a patient with a history of asthma experiencing shortness of breath and wheezing. Or D, a patient scheduled for discharge needing medication education. So which one? If you need me to repeat it, I'll repeat it. All right, you say C, C, C. Who said C's get degrees? We say C, C, C. All right, cool. Well, I think C. I think we have a general consensus that it's C, and it is C. Look at y'all, Trevor. You're Trevor. It's C, sir. It's C, not D. So a patient with a history of asthma experiencing shortness of breath and wheezing. And the reason being is because that's saying he is currently experiencing shortness of breath. Remember ABCs, right? So in a prioritization of care, life-threatening situations should always take precedence. A patient experiencing shortness of breath and wheezing with a history of asthma may be in respiratory distress and needs immediate attention to ensure adequate oxygenation. The nurse should prioritize this patient's care over the others to prevent potential complications such as respiratory failure. I think we could all agree on that, right? So the one thing that I like to try to tell people when it comes to these questions is that you really do have to break the question down. So what exactly is the question asking you? Number one. Number two, how can you reword it for the question to make sense to you? Do you need to move something? I'm not trying to tell you to change the entire question, because if you do that, you're not going to get the answer right. But you definitely want to put it in layman's terms for yourself. Like, what is this asking? Okay, it's a prioritization question of who I need to see first, right? So if we're talking about level of conscious or hemorrhage, level of conscious, ABCs, right? So diabetes with a blood sugar check after lunch, not a priority. A patient who just returned from surgery and is experiencing postoperative pain. Well, is that an expected outcome? I think so, right? Because who's not going to be in pain when they come from surgery, right? So that's an expected outcome. We already talked about the asthma, and then it says the patient scheduled for discharge needing medication education. That's not a priority at all whatsoever. That actually would be last on the list because they're leaving. So at that point, we already know and assume that they're stable. All right. So there's that question. How'd y'all like that? How'd y'all like that? How did all 31 people like the fact that I just talked about an NCLEX style question? You see what I'm saying? They good to go home. They can wait. Facts. They was like, look, I ain't got nobody in here to talk to me. Look, some of these patients, while they're great, they be out of pocket. They be out of pocket. I'm just like, look, hey, so here's one thing that when you hear patients complaining about things, especially if you're spread so thin as a nurse, sometimes you tell them, they're like, man, I want to do this. I was like, you know what? I understand it. But a lot of times this is what I say. I was like, sir, ma'am, I understand how you're feeling X, Y, and Z. And I was like, but nobody ever got better laying down. And I was just like, the one thing that I tell patients is like a hospital is the most expensive and uncomfortable hotel you will ever stay in. And I was like, so it would behoove you, and I don't say that word often. Wow. It would behoove you to, if it's time for you to get up, let's get around, let's get walking. You ain't got to go, but you got to get out of here. Like, I want you to go home as fast as possible because you will do so much better being at home rather than, yeah, I know, Amber, I know. I'm working on that. But, yeah, the faster you get better, the faster you get out of the hospital, the better you recover. All right. So cool. I'm glad everybody liked that question. Hey, shout out to all 26 of y'all that are up in here. We just went over an NCLEX style question. I know a lot of people have been wanting that, and I know Thunder's not here, and Thunder's probably going to miss it. So I'll just be like, hey, you can just go check the replay to prove that I went over NCLEX style questions. I specifically did this because Thunder was just like, hey, I want to do that. I was like, all right, cool. I got you. Right. So, shout out to all of y'all that are in here that are listening to this. Make sure you guys share this with people because you never know. You never know who may need it. Alondra, another one? All right, cool. I mean, since you asked, that, I'll have another one. Oh, look at that. There's one right there. Yo, I got you. Can we do another one, please, if you have time? Yeah, I got you. Hey, so ironically, there's 10 of them that are right here. It's not, I wasn't even ready. But I got 10 right here for y'all. I don't know if you guys hear my other co-host. He's crying for something. Hold on, give it a second. He's crying for something. I don't know what it is. All right, cool. I got you. So here's our second NCLEX style question. All right. And just FYI, these are all multiple choice questions. I will be doing some other ones that'll be select all that apply and the multiple response and the case scenarios, right? Because those are the newer format of how the questions are asked. So those will come in the future. All right. As well as if you bought the 7-day NCLEX course, if you're a brand new nursing student, those types of questions are going to be in there as well. I'm actually going to be doing videos that are going to be breaking those down. So here's our second one. A charge nurse observes a nursing assistant providing care to a post-operative patient. The nursing assistant is wearing gloves and a mask, but fails to perform hand hygiene before and after patient care. What should be the charge nurse's immediate action? Yeah, select all they apply. They are the bane of everyone's existence. You ain't the only one, girl. Trust me. A, report the nursing assistant to the nursing supervisor. B, provide immediate feedback and education to the nursing assistant. C, correctly perform hand hygiene for the nursing assistant. Or D, discharge the nursing assistant from the care area. Happy Matt says education, so I'm assuming that's C. Oh no, that's B for education. That's what you said. Thunder says C. Who else says B? Alondra says B. Alicia says C. Education. Okay, B for education. Repeat, please. Joanna, keep up. Oh my God. Joanna, you missed this one. I'm sorry. I can't repeat it. There's so many people have already answered. All right. Stay with me. As a matter of fact, Joanna, since you didn't hear me, I want 2,000 likes right now. I want your thumbs and fingers to be hurting. Do it right now. Do it right now. All right. So the general consensus looks like B, which is provide immediate feedback and education to the nursing assistant. Let's see if you guys got it right. And the correct answer is provide immediate feedback and education to the nursing assistant. So it is essential for healthcare providers to follow appropriate infection control practices, including hand hygiene, to prevent the spread of the infections. The charge nurse's immediate action should be to provide constructive feedback and education to the nursing assistant about the importance of proper hand hygiene. Reporting the nursing assistant or taking disciplinary action may be necessary depending on the severity and the recurrence of the issue, but education and feedback should be the initial response, right? So you got to think, us as nurses, and this is probably somebody was asking me about the dynamic about being a nurse and also being a corpsman, or just the dynamic between nurses and corpsmen. It's all about the teaching aspect, right? Like if you were messing up, like there's things that corpsmen can do that no CNA can do, right? Because obviously they don't have the credentials to do that. So now what I would say is it's all about teaching. It's all about, showing them how maybe and this is probably going to sound really silly to say, maybe they don't know how to properly wash their hands. There's a diagram, there's videos, there's health streams, there's whatever, right? So maybe they need more education on how to properly wash their hands, right? Maybe they got to say, oops, I did it again. You see what I'm saying? She's kind of crazy now. Shout out to y'all. But no, seriously, like maybe they don't understand it. Maybe they don't know, or maybe they haven't been doing it properly. You know what I'm saying? So that immediate feedback to fix the action rather than try to, take disciplinary action, can actually alleviate that problem. Versus if they go into a C. diff room where it's contact precautions, where it clearly says wear gloves and masks, and then you decide to be touching all over the patient and then rubbing all over your face being a weirdo, then that right there, that's above like, hey, I can fix you. I'm going to have to fix you on top of I'm going to have to report this because now you are an infectious disease issue, if that makes sense. Okay. So hopefully that makes sense to you guys. Was going to grab her hand and wash them like kindergarten. Answer C, right? Hey, come here. You start doing that now, so right there, right? So seems like nursing in general is education and critical thinking. So Here's the one thing. Okay, so with the NCLEX test plan, the 2023 NCLEX test plan that came out on April Fool's Day, and this is not a joke, this is not a game. So it is very geared towards critical thinking and clinical judgment. Everybody around the nurse, including the providers, get educated in some way, shape, or form. And that's what it is. It's all about education. It's all about critical thinking, and it is all about clinical judgment. That is what your NCLEX is about. It says it in the abstract. I may have read it 4 or 5 times, and I may have designed my course based off of that because that is the blueprint. But anyways, so hopefully that answered you guys' question. How you guys feel about that? Let me know. Let me know down in the comments. I got 21 people up in here that are just listening to me run my mouth, and we're talking about NCLEX style questions and all that good stuff. Y'all tell me how y'all felt about that. And before I go on to another question, shout out to all 20 of y'all that are in here hanging out, listening to me run my mouth. If you're new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. Right now, we're talking about NCLEX style questions. NCLEX style questions, if you guys don't know what the NCLEX is, the NCLEX is your licensing exam for if you're going to be a registered nurse or if you're going to be a licensed practical nurse or a licensed vocational nurse, depending on where you live. So I wish I would have done something like this before I got into nursing school. When I went to nursing school, it was just like, yeah, you'll figure it out. You know what I mean? So let's see what we got. Just kill that like button to get you to. Hey, shout out to you, Amber. I'm saying, hey, look, you want to know why you killed that like button? It's because you got hands and they're strong because you be fighting folks. I'm just saying. No, but a shout out to you. I appreciate that. I got 2 years till I take the NCLEX. Let's go. Nursing school starts next Wednesday for me. Shout out to you, Happy. That's what I'm talking about. The 7-day NCLEX course, it would be perfect for you, sir. $48. By the time you graduate, everything's going to be there. And then you're going to be like, hey, yo, I got an NCLEX course for $48 like 2 years ago. And it's awesome. Just saying. Links in the bio. Check it out. Hey, and by the way, share with your other folks that you're in school with. I'm just saying. I'm Kari. I'm from South Florida, currently in an ASN program at Kaiser University. Shout out to you. Okay. Gonna start advanced med surg next week. What topics do you think I should brush up on? For med surg, think about your body system. So cardiology, musculoskeletal, respiratory, endocrine. What else? Gastrointestinal, reproductive. Brush up on those. Definitely brush up on those. Taking the NCLEX in December. Shout out to you, Rita. Shout out to you. Hey, so you taking the NCLEX in December. We're currently in August, so that's telling me that you're in your last semester of school. So I want to probably by October, November timeframe, you need to be getting yourself in NCLEX mindset mode. Okay, I'm graduating with my BSN in December. Becca, that same thing for you. Same thing for you. That you need to be by the time because graduation's in December. By November. By the beginning of November, end of October timeframe, mindset needs to start getting towards NCLEX. Even though you're going to be thinking about things at the end because, you may have a capstone, you may have an exit exam. You got to get into that. You got to get into that mindset early. That way, when you graduate and they send your authorization to test out there and then you get it back and then you can schedule your NCLEX, you can go schedule your NCLEX 2 weeks after you get it or a month after you get it. Because the faster that you get there to take your exam, the better because you still have all that knowledge is fresh in your head. Okay. Hopefully that makes sense for you guys. Those last two were for Becca and for Rita. So, do you take a different NCLEX if you do the ADN or BSN program? No, they are both the same NCLEX exam. So if you go to ADN RN program, you get your ADN, you'll get your RN, and then next thing you know, you can freaking do an online program and take your BSN one class at a time. Remember, it's still the same license, right? Take your BSN one class at a time. One class at a time. Next thing you know, you'll build up all this experience as a 2-year, as an associate's degree nurse, and then boom, you get your BSN. Honestly, if I could have done it all over, that's what I would have done. I would have went to an ASN program or an ADN program. But when you don't know what you don't know. I did not know at all that there was an associate's degree program. Because when I was in the military, all I was trying to do was get my bachelor's because in the military, they will not commission you as an officer unless you have a bachelor's degree. So bachelor's degree was the only thing for me. But if I would have known I could have gotten my associate's degree in nursing, gotten my license, and then just taken classes online, I would have already had 2 years of experience, gotten my bachelor's, commissioned as an officer, and then gotten I would have got, they would have I would have went from like '01 to '02. I would have completely skipped like a bunch of years as an officer. Like they would have like not grandfathered you in, but they would have advanced you in rank. You know what I mean? So do you think the benefits of the military are worth it? It all just depends on what you want. When Alondra, when I joined the military, I was 19. Oh yeah, y'all asked me how old I was and I didn't tell you, huh? All right, how about this? I joined the military when I was 19. And next month will make it 16 years in the Navy for me. Okay. So you do the math. But it all just depends on what you want. The benefits on the outside, you get paid on the 1st and the 15th. You, got full medical, you got full dental, you get a housing allowance, you get, a food allowance. If you're enlisted, you get a uniform allowance. If you're an officer, you get paid more than everybody. This ain't math, bro. You're right, bro. It's not. And math is not my strong suit. Like, I don't math. My math ain't mathing ever. So, but yeah, you do get all those benefits. Like, if you do a certain amount of time on the active duty side, especially if you go on enlisted, you get the GI Bill for you to pay to go to school. If you're in, I believe, like 180 days consecutively on active duty, you're eligible for the VA loan for you to go to school, not go to school, but for you to, your VA eligibility for you to buy a house. So it all just depends. But on the other side, you're thinking about work-life balance, the work environment. Is it even for you? The hierarchy of the military, PT, because a lot of people are just like, I don't want to fucking work out. Like, there's a lot of stuff that's there. So. And I can tell you right now with my GI Bill, not my GI Bill, but my VA eligibility to purchase a house, I've purchased 3 houses and I had to put 0 down payments on any of them. So, and 2 of them are rental properties. Just saying. So, but like I said, like the military is a different breed. It's a different cup of tea. And then you also got to be ready for deployment. And then you have to be mentally prepared that if you have to make the ultimate sacrifice. And I'm not even going to get into that. So I'm just keeping it real. I'm still trying to decide on CRNA or not. Well, how about this? Put CRNA on your board, right? But then just take it one step at a time, right? Because you're about to start nursing school. That is the prime directive. That is your prime focus. So put CRNA on your I Love Me board, like circle it really big. And, but just be aware that, by the time you get through nursing school, you may not want to be it. You may not want to do CRNA, period. That's what I want to do with houses. You can do it, Joanna. You can do it. Anesthesia work is dope. You're right. One step at a time. Facts. All right. So I got 14 of y'all in here. Y'all are still smashing that like button. I love it. I love it. I love it. I love it. Amber, I know you over there tired, probably sweating, got cramps and carpal tunnel, but girl, keep doing it. I'm just saying, get them calluses on them fingers, girl. Shout out to all 15 of y'all up here. Hey, y'all ready for another question? Let me know if y'all are ready for another question. Did you join the military right out of high school? I did not. I did a year of college, at a community college, was not a big fan of college at all. And in reality, I was not ready for college. I had no discipline. I was just a fucking turd. Hey, hey, the other goon is here. Nurse Cass. Hey, I just want to let y'all know that's my other bodyguard. Her and Amber are my 2 correction nurses and corrections folks. All right. That's my other co-host. I just want to let y'all know if y'all are not smashing that like button, she will fight you. I'm just letting y'all know. And shout out to all of y'all that are sharing. Make sure you guys keep sharing because we're going to keep going through these questions. All right. And make sure y'all follow me. Be my friend because I ain't got none. I'm lying. I got friends. You know what I'm saying? I just want y'all to be my friends so I can get to 3,000 and I could actually stream from my computer. I think that would probably actually be easier. That way you guys can see what I'm talking about. You know what I'm saying? So, all right. Somebody said we ready for another question. I need a general consensus that y'all are ready for another question. That's all I want. Oh, that's good. Oh, that's nice. Oh, here it comes. Here it comes. Bye-bye. Somebody tried to come and infiltrate me. Oh, there he goes. All right, here we go. I'm about to read this question. Hope y'all ready for it. It says, a patient is diagnosed with end-stage renal disease and is considering different treatment options, including hemodialysis and peritoneal dialysis. What is the nurse's best action to support the patient's decision-making process? Is it A, provide the patient with written information about the benefits and risks of both dialysis options, B, advocate for hemodialysis as the preferred method due to its proven effectiveness. C, refer the patient to a support group of individuals who have undergone dialysis treatment. Or D, offer personal opinions and experiences of other patients who have chosen dialysis. You know what, Nurse Nelly? I don't know, because I was talking about you earlier. I don't know why. I should just start just texting you and letting you know that I'm here. So I'm just going to do that from now on. But now, Nelly, we're going over NCLEX style questions. You said A. Okay. You say A, Alondra. Okay. It's like I say A, but C sounds good too. It does. It does sound good. Remember, when you start taking these tests, these NCLEX style questions, you'll have some that are right, but then you'll have those ones that are more right. You should definitely text me. Yeah, I got you. I got you. I see Aubrey up on here too. A or C. Joanna says A or C. Okay. You say A or C. What else we got? What else we got? I can read it again if you want me to. I'll give you, this is y'all's mulligan right here. I could do a do-over. I'm helping Aubrey study for her biology test. Shout out to you. I'm sticking with A. Okay, you sticking with A. All right, what else we got? What else we doing? Read it again. Okay, I'll read it again. Here we go. Hey, I need all 17 of y'all to pay attention. Hey, right here, right here, right here. Amber, you keep doing what you're doing, but the rest of y'all right here, okay? All right, a patient is diagnosed with end-stage renal disease and is considering different treatment options, including hemodialysis and peritoneal dialysis. What is the nurse's best action to support the patient's decision-making process? Provide the patient with written information about the benefits and risks of both dialysis options. B, advocate for hemodialysis as the preferred treatment due to its proven effectiveness. C, refer the patient to a support group of individuals who have undergone dialysis treatments. Or D, offer personal personal opinions and experiences of other patients who have chosen dialysis. Cass says A. Amber says A. Marty says A. Misguided says A. Okay. What else we got? What else we got in there? Somebody else in here said C or A, or no, I think you said A. You was like, I'm going to stick with A. I think that might be the general consensus right there. Make sure you guys keep sharing. Evelyn, you think it's C? Okay. So C, refer the patient to a support group of individuals who have undergone dialysis treatment. Okay. All right. How we doing? I think we have a general consensus between A or C. Nobody picked B, and I'm just keeping it all the way real. None of y'all better have picked C, because your opinion is irrelevant. I'm just keeping it real. Don't nobody care about your opinion when you're taking this exam. Because remember, nursing is not about opinions, and it's not about feelings. It's about logic, and it's about facts. Just saying. Keeping it all the way real. Make sure you guys share this, all right? Because I want folks to look, right? Happy Matt, I believe, sir, you said A, and that's what you're going to stick with. How long have you been on? I've been on since 5:30. Man, so you went like a whole hour and you didn't even know? Yeah, I'm just definitely going to text you from now on. I got you. Don't worry about it. Don't you worry about it. Hey, shout out to y'all, right? All 16 of y'all. My other co-host, Nurse Nelly, is here, right? 4-year nurse, ICU, tele, med surg, now case manager, doing her thing. Helping out baby girl with her biology. Love it. Shout out to you. All right. So I think we have our general consensus. It was either A or C. So let's see what it is. If you chose A, you are correct. The nurse's role is to provide the patient with objective and evidence-based information to support their decision-making process. Providing written information about the benefits and risks of both hemodialysis and peritoneal dialysis allows the patient to make an informed decision based on their preferences, lifestyle, and medical condition. The nurse should avoid advocating for a specific treatment option and refrain from offering personal opinions or experiences, as it may influence the patient's decisions inappropriately. All right, so if you chose A, you are correct. Give yourself a pat on the back. You are the real winner person. What made you decide to go into the military, and when did you join? I decided to join the military because I was a knucklehead. I didn't know what I was doing. I had no direction. I didn't know what to do. I really didn't know what to do. And I knew for a fact I did not like college at all. I was not a fan of college. You know, nobody's holding your hand, forcing you, telling you to go. There's no truant officer. You know, I was doing shit I shouldn't have been doing. Messing around with folks I shouldn't have been messing around with. Like I said, I was a young boy with no direction. And in the military, I joined it. I asked a couple of people. They were just like, hey, try it. If you try it for 4 or 5 years, you'll get more benefits out of it than you would if you didn't try it. And I was like, And I joined during a time of war. I joined in 2007. So, that just kind of came with the territory at that point. So yeah, that's kind of how that's kind of the synopsis or the snapshot, not synopsis, but the snapshot. How hard was nursing school? Hard. It was hard, Sam. It's hard. It's hard. Time management, understanding, all kinds of stuff. For real, nice. Thanks for answering. Yeah, no problem, Joanna. I got you. Shout out to all 18 y'all up in here. How do y'all feel about that question? I had everybody that answered A, right? But I had one person answer C. The person that answered C, do you understand why C was incorrect? And the reason why, when I do my coaching to people, like when I do my one-on-one coaching with people, this is exactly how I facilitate it, right? Because I don't want you to feel like you're stupid. Or I don't want you to feel like, like you're not smart because you didn't get it. Because you're not going to get them all right. And that's okay. The NCLEX is the NCLEX is essentially based off of a 0 to 100 scale. And you need to cut a 50 or higher. Right? Name any other type of exam where you have to cut a 50 and it's passing. Think about that. I'm glad that you like that question. I didn't go to bed until 2 o'clock this morning, and I had to be up at 6:30 because I was making these questions. Because I told Thunder, I was like, hey, I didn't do it. I'm sorry. I have it. I just need to finish them. I had them here, and I just needed to put some more on there. Okay. So I want to let y'all know that's what it's there for. Okay. Got to go. Bye. Okay. Bye. Sam said, currently taking prereqs before nursing school. What is more important, chemistry or anatomy? All of them. Because if I tell you that none of them is going to be important, then you may not decide to take one seriously. But here's the reality of it. Just like you said, Sam, you are in prerequisite classes. If you decide to spend all your time and be like, you know what, fuck chemistry, but I'll do everything I can in anatomy. But then you try to go to nursing school and then they look at your application and you got a D or a C in chemistry. And remember, nursing school is already competitive. So if you ain't trying to put your best foot forward and strive to get A's to essentially destroy everybody else, it's important and it matters. So all of them matter. Especially all of your classes matter, but especially those science classes, A&P 1 and 2, micro, chemistry, nutrition, like human growth and development, all those stuff. Yes, learn as much as you. I'm telling you, because once you get into the nursing classes, like it's not going to make sense, but then it will, So don't let me be up here trying to like skew your thought process, because I ain't trying to do that. You know who ain't here? Cass? Sasha. I don't know where she at. I'm gonna need for you to find her and bring her no nonsense self up into this chat. All right. So how do we feel? How do we feel about that question? I know Joanna already told me how she felt about that question, but I got another question up in here. But before I do that, shout out to all 21 of y'all that are in here. If you're new to this channel, first of all, you need to follow me, be my friend. I need 3,000 people so I can stream from the computer so y'all can see the question. You heard what I just said. I need 3,000 people. I think I'm at like 2,800. I need 3,000 people so I can stream from the computer so y'all can see the question. You see what I'm saying? So stop playing with me. Stop playing. Because follow me, be my friend. I'm going to tell you why. Because if not, I'm sending Cass after you. All right. I wish I had Nuck If You Buck on right now. I'm just saying. But shout out to all y'all. All right. But if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Prerequisites, nursing school, a nurse. Have you been a nurse for 20 plus years? You've been a nurse for 17 plus years, fighting folks in corrections and working in psych. You've been a nurse for 3 years. There was somebody in here who said that they work in infection prevention and they love it. Shout out to you. So, I want to know who you are. We're trying to foster that in our chat, as well as we're going through NCLEX style questions. And now I feel like since I'm doing this, it's going to be a norm and people are going to be like, can you do questions all the time? And I'm like, I guess, you know what I'm saying? So I got y'all. Yes, learn so much in prerequisites facts. Let's talk about the entrance doses. Wait, what? Let's talk about the entrance dosage exam. How did it go for you? To be honest, I don't even remember. And when we had to do our entrance exam, Sam, everything that we did was done. I had to do a HESI, and everything was on HESI. So whatever was included with that, which was in 2016, that's where it was. And I honestly don't even. There was dosage calculations on there, but it wasn't a lot. Hell, even on my NCLEX, I think I had one. No, on my NCLEX, the last time I took it, I didn't have any. But the first time I had two. Second time I had two. Third time I had two. So, I had a class where students were cheating on their chem exam. Did you cheat with them? Because if you ain't cheating, you ain't trying. Maddie, I'm just playing. Hey, but for real, did you cheat? The dosage exam in farm, it was straightforward. Yep. Okay. Because all it is conversions, dimensional analysis. Because when you're in nursing school and you get to pharmacology and they get to that dosage calculations exam, you have to get 100. You have to get 100. So, and I hated it. Like there's someone's life in your hands. Now imagine if that was your family. Facts. ER, remote triage, 8+. Hey, so you sit at home doing remote triage? All right, Mama, too. I got you. My anatomy professor gave us unlimited attempts on our exams. Hey, that's okay, though. I ain't even mad at that. Any advice for new students who are doing LPN school? Well, Anita, the one thing I'll tell you is be ready to cut everybody off. Be ready to really, really hone in on it, because if you don't, you're going to have distractions. I can guarantee you, for all of y'all that are about to start nursing school, within the first month, y'all are going to feel like you're drowning and you're going to feel like you're not going to make it. But I'm telling you right now, you don't have a choice. All right. I want you to hear me. I want you to hear my voice. You don't have a choice. So you better get down and you better push. That's why I tell everybody, you better get your face in the dirt and you better push. Just like I'll start throwing a lot of military analogies at y'all because the shit gets real. All right. What's the worst thing that can happen to you? Right. What's the worst thing that can happen to you while you're okay? You're going to feel overwhelmed. You better get over it and you better push through it. Right. Because if that's what you want, if this is the dream, this is what it takes for you to get there. All right. Be ready to be in a group. Get into a study group, 4 people, you and 3 other people, and then share notes with one another. That way you guys have a Google Docs full of notes, to where you guys all feed off of each other. So you split it up 25%. You see what I'm saying? Start the teamwork aspect of nursing right from the beginning. All right. And I can tell you another thing that nursing schools like to do. They talk about cheating a lot. If you share notes with one another, that's not cheating. I had girls I was in school with that I was like, hey, can I borrow your notes? And they're just like, no, I don't want to get caught for cheating. And I'm like, what are you cheating on? You wrote that unless you got the test answers. Then you can give me those too. But anyways, you see what I'm saying? That's what I'm saying. So, yes, that's what I had. I didn't have any for every class. Nursing school sounds like hell. Nursing school is hell. It's kind of like how it feels outside. 105 for no reason. That's what it feels like. In orientation, they said you're going to get good at canceling plans. Facts. You, hey, whatever you got planned, just throw it away. Throw it away. Hey, I'm gonna tell y'all. One time I went to Las Vegas while I was in nursing school. This is when I was married, and that was the worst time I could have ever had because all I had on my mind was an exam that I needed to do on the computer. Do not do it to yourself. Listen to me. Any tip for anatomy and physiology? Well, Jen, anatomy and physiology. So anatomy 1, if it's taken that way, anatomy 1, anatomy 2, or A&P 1 and 2. First half of the book is A&P 1. Second half is A&P 2. All anatomy and physiology is memorization. What sign are you? What does that even mean, Sam? What is that? Why does that even matter? You know what, Sam? What do you think my sign is? Nursing school is character building. Facts. I take my LPN NCLEX in 3 weeks. Is it Tylet? Is that how you say it? Tylet? What you crying for? Hey, as Dirk says, stop with all that crying. Don't cry. You're going to be all right. Because I know it. It's given Gemini. First of all, you think it's probably... No, I'm not. Is it because it's like I'm passive and aggressive, or I'm just like, yeah, like I'm super happy, and then I get real serious and I start like knife handing folks? Is that what you're talking about, Sam? Is that what you're talking about? You think I'm crazy? I'm talking about NCLEX style questions, and I'm trying to help you. And now you mad? Don't be mad. That's all good, girl. Don't be mad. No trips during school. I'm planning a cruise when I finish. Hey, you should. You really should do that because that really helps mentally right there. Your different personalities love it. No, ma'am, I am not a Gemini. I'm not. It's just like when I get on here and I start talking, I get real excited. Like this is honestly like one of my favorite parts of the day is when I get on here and I get to talk to y'all. All right. So shout out to all 36 of y'all being up in here listening to me run my mouth, and Sam over here asking me what my sign is, like it matters. Like it matters. Shout out to y'all. Hey, if you guys are new here, welcome to this crazy live we got going on. My name is Kevin. I go by the Boot Nurse on all social media platforms. 2 things: smash that like button. Second thing, you need to share this. Third thing, you need to be my friend. You need to be my friend, number 1, because you want to be. You want, Sam, if you ain't my friend, since you like to ask me all these questions, I'm going to need for you to be my friend. Like at least like 45 times. I don't even know if that's a thing. Is that a thing? Don't matter. So shout out to all of y'all. And If you're new here, I want to know who you are, where you're from. We're going over NCLEX style questions, so I want to know where you are in your nursing journey. And if you're a brand new nurse, or if you're a nurse who's in their prerequisites and are trying to go to school and want to get a jump on things, check out the 7-day NCLEX course. That link is in my bio. It is for $48. You spend more on Amazon every day. You don't lie to me. Don't lie to me, okay? Because I know you do. All right. Check that out. It's going for $48, 80% off. Check it out. It's in its pre-launch phase right now, so I'm updating things consistently. As a matter of fact, I have 10 videos that I recorded that are getting edited right now. Well, obviously not right now because I'm sitting here talking to you, but I'm going to be putting up 10 videos, as well as I have videos that are next to go up, talking about the next generation NCLEX, talking about questions and answers like this, on top of, you know, like what to expect for taking the NCLEX, the different type of questions, you name it, it's going to be on there. All right. I'm just saying. All right. Let's say Jerry says just study, don't fall for or buy anything. Well, Jerry, I mean, that's your opinion. You don't have to fall for or buy anything. I don't know what we're talking about fall for. Any tips for T's, the T's exam, or how to study for the entrance exam? NYCJ, I would look at the Mometrics book for T's. It's like a yellow book you can find on NCLEX. You can find on Amazon, and it's like $33 or something like that. Don't be nervous. You'll be all right. Jerry said, yeah, don't fall for anything, yada, yada, save your money. Well, I mean, it depends on how you learn, Jerry. Jerry, how you going to come up in here and tell somebody to save their money? Like you pocket watching? Get out of here. Buy a T's book off Amazon. Yeah, exactly. Like $20. Yep. Happy said, the yellow book, Mometric. Yeah, so the Mometric book is pretty good. Like, it really is pretty good. But anyways, like I said, shout out to y'all. Hey, Cass, 600. Give him a 600. Hey, so if y'all don't know what a 600 is, y'all will hear me say it. So a 600, I actually adopted from another YouTuber I've been following for years. His name is the Black Hokage. He's a gamer. Shout out to all my gamers and my anime heads that are out there. You know what I'm saying? So shout out to y'all. And anytime anybody used to come in his chat that will be talking all kinds of nonsense, I don't know nothing about me or nothing about y'all or what y'all are trying to achieve, regardless of whatever their opinion is, they start doing a lot of this. And they don't know nothing about me or you. And so if you come up here talking nonsense, I'm going to give you a 600. And a 600 means that's 600 seconds, which means it's a 10-minute ban. AKA, you getting banned from my whole stream. And I ain't going to be on here for 10 minutes. I'm just letting y'all know that. So you want to come up here and talk foolishness? Hey, we can talk foolishness. You want to come up here and troll? Hey, best believe I can troll you back. Yeah, I think I am giving off Gemini vibes. My bad, Sam. But I am not a Gemini. I promise you. All right. So how do y'all feel about doing another NCLEX style question? How y'all feel about that? Y'all let me know. Let me know the general consensus of an NCLEX style question. I got another one. I got 10 total, and we're on question 4. I'm just saying. Ready? Ready. Cool. All right, here we go. She's like, let's do it. All right, here we go. So a patient diagnosed with a major depressive disorder is admitted to an inpatient psychiatric unit. Okay. The patient is prescribed selective serotonin reuptake inhibitors, or SSRIs. The nurse observes the patient becoming agitated and displaying signs of increased suicidal ideations. What is the nurse's immediate action? Okay, cool. So what kind of question is this? What kind of question is it? We'll break it down together. So is it a prioritization question? Do we need to assess the patient? Do we need to implement? Obviously, the words are already in there. Right? So y'all tell me. We can work it together. This is why I wish I had 3,000 people that loved me, because I can show y'all. But I know y'all love me. I appreciate that. All right. So yeah. So we're going to break it down. So this is why I say that content is so important, right? Because a lot of y'all that are new, that don't know anything about nursing and about medications, you know, like, what is an SSRI? Okay, cool. It's a psychiatric medication. Okay. Now with this SSRI, if you like, this is where you're just like, all right, so what are the signs and symptoms of somebody that could be on this medication? Right. And now they're talking about, you have a patient who is on this medication who is displaying agitation and signs of increased suicidal ideations. So what do I need to do right now? Like, that's why I said, what is the immediate action? What do I need to implement? I don't need to assess the patient, especially if we're talking about ADPI, right? right? I don't need to assess the patient because the patient is already displaying, they're already displaying aggression and increased suicide ideation. So I need to actively do something right now, right? So I need to implement, right? And then you got to think, is this a physical or a psychosocial thing, right? They're displaying aggression. Is that physical or psychosocial? Think about it. Is it physical or psychosocial? You can't abruptly stop SSRIs. You are correct. You cannot. You have to taper off of those. Physical. Restrain the patient. All right, Joanna, you got to hold on to that one. Physical. There you go. And I know Cass is in here somewhere because Cass is the psych nurse. So I'm surprised she's not answering anything up in here. All right. So yeah, it's a physical, right? And then remember, we're thinking about like the ABCs aren't really necessary. So it's just like, all right, now how are we going to, like, what will be our next plan of action, right? So here are our answers. We're going to notify the healthcare provider and request a change in medication. B, implement a one-on-one observation to ensure patient safety. C, encourage the patient to participate in group therapy sessions. Or D, administer a PRN dose of lorazepam to manage aggression. Of course, it's physical first. Cass, don't do that. Don't do that. We all say B. Okay. B. I'm giving everybody that chance, for them to answer. So you say B. Okay. Okay, B. Repeat the answers. Okay, Joanna. Okay, so A, notify the healthcare provider and request a change in medication. B, implement a one-to-one observation to ensure patient safety. C, encourage the patient to participate in group therapy sessions. Or D, administer a PRN dose of lorazepam to manage aggression. Gabby, you came in late. I'm not repeating the question. You just have to be here for the next one. Oh my God. That was good. Fucking delicious. B. Okay. B. What else we got? We all say B. What are you eating? Joanna, answer the question. Don't worry about what I'm eating. Answer the question. All right. I did. B. Okay. I was eating potatoes. All right, so the general consensus says B. Let's see what the answer is. The answer is B. Implement a one-to-one observation to ensure patient safety. So here's your rationale. The patient's increased agitation and suicidal ideations are serious concerns that require immediate intervention. The nurse's immediate action should be to implement a one-to-one observation to closely monitor the patient and ensure their safety. Safety is number one, right? The NCLEX is all about nurse safety. One-to-one observation involves assigning a staff member to be with the patient at all times, providing continuous support and intervention if necessary until the situation stabilizes. The healthcare provider should also be notified promptly about the patient's change in condition for further evaluation and possible adjustment to the treatment plan. Okay? You never want to start out with medications, right? Because medications are essentially is like what they call a chemical restraint, right? We don't need a chemical. You just got 10,000. What are you talking about? I got 10,000 what? I just got 10,000 what? Amber? What you mean? I don't know what you mean. But anyway, so yeah. It says I only got 6,000 right here. What you mean? I don't know. I bet you they cut you off. They were just like, cut her off. She over here doing too much. But yeah. So does everybody understand that? 6.4? Yeah, it says 6.3 on mine. How did everybody feel about that question? Oh, so we like that question? All right, cool. All right, Cass, you got anything to say about that as the expert psych nurse here in the chat? He said it's fine. She's like, whatever. Pretty straightforward question, right? I wasn't trying to make it super hard. But then there's going to be some other ones. I purposely grabbed some really, really tough ones in here, which require you, to do a little bit more thinking, right? So I got some. So all right, Cass ain't got nothing to say. So I was like, all right, cool. Yeah, let's do some hard ones. Okay, well, I'm just going to go in the order. I can't remember exactly where I embedded them at, but we'll just keep going. The biggest thing is that you get into the routine. You get into the routine of doing these questions. You read your question. If you don't understand it, read it again. If you still don't understand it, then read your questions. Then read your answers, because a lot of times you could read your answers, and when you read your answers, you're going to be like, that can kind of give you a little bit more clarity. Okay, it's been fun hanging out with y'all. I need to start studying. All right, Matt, go study, man. I appreciate you coming by and, dropping in your 2 cents, man. Just we do this every Monday, Wednesday, and Friday around 5:30. Texas time, Central Texas time. Or not Central, I guess it's more Southern. But anyways, thanks for being here. All right, we'll jump to another question. But shout out to all 23 of y'all that are in here. If you're new, welcome to the channel. My name is Kevin. I go by the Boot Nurse on all social media platforms. I want you guys to go over there and check those out. If you guys miss any of these lives, if you guys are subscribed to my YouTube, every live that I do, for the most part, unless I don't get, unless I don't get in trouble by TikTok for doing something, it's going to go up. I actually haven't even put on my TikTok. I didn't put the one for Monday up yet. And actually probably the best TikTok I've had. I had like 21,000 likes on top of I had on average, 100 people following me or watching me, which is wild. So, that was actually fun. So make sure you guys go over there and check that out. And yeah, who's ready for another question? Who's ready? Who's ready? There's 18 of y'all up in here. So who's ready for another question? Who's ready? I'm ready. I'm ready. I'm ready. I'm just saying. Oh, we're good? I commented twice. Ma'am, I didn't see anything that you put. Gabby, you're still in nursing school? Okay. You good, though? Nursing school going to fly by. And the next you know, you're going to be like, hey, there was that one guy that was talking about NCLEX style questions. I should probably go back and follow him. Cass, I didn't see nothing that you did. I didn't see nothing that you put up here. Just joined, ready for the next question. How you going to say just joined, ready for the next question when you weren't here for the previous questions? You mean you ready for just a question, Bree? Come on now. I'm just playing. Shout out to you. Welcome, 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 welcome. Hey, for 15 of y'all that are in here, if you guys don't follow me, on TikTok, what are y'all doing? I'm just saying that if y'all don't follow me, I can't put the questions in front of y'all. I can't put the questions in front of y'all so y'all can visually see it. I know I got my visual learners out there. I'm just saying. So make sure you guys follow, throw your boy a follow. I'm just saying. All right. So if you guys are ready, I'm ready. We'll jump into this next question. All right. All right. A patient with a history of diabetes and peripheral neuropathy is admitted to the med-surg unit with a foot ulcer. Now paint the picture. Paint the picture, okay? Which nursing intervention should be the priority in managing the patient's foot ulcer? Is it A, initiating antibiotic therapy to treat the infection? B, administer prescribed pain medications as needed? C, elevating the affected foot to reduce swelling? Or D, perform daily dressing changes using aseptic technique? What do we got? What y'all thinking? What are we thinking? What are we thinking? What are we thinking? Let me know the answer. Cherie says A. Gabby says I'm stuck with C or D, or C and D. Chrissy says C. I'm not the best with exams. Gabby, if you're in nursing school and you're trying to be a nurse, you better be good. You better be real good with exams, because I'm telling you, your exams as a nurse will never ever stop. Bree says A. Martine says D. KT says A. Sharice says A. And you say A and B, Sharice? You can't pick A and B. I mean, you can. But then, you can't pick A or B unless it's select all that apply. And that's not what we're working with right now. Joanna says A. Is that the general consent? All right. So the general consent to A. I need final answers. It's A, B, C, D, E, all the above. E's not on there. All right. So you say A. Okay. Cherie says A. Who else said they couldn't make up their mind? Gabby. It's either C or D. Which one? Or whatever your answer is. What it is. Oh my God. What is it? Says A. Is that an owl? Hey, little owl. I'm going to go with C. All right. C. Final answer. Shout out to, all right, Blanco. I see you with the owl. Appreciate you, sir. All right. So if you chose A, initiating antibiotic therapy to treat the infection, you are correct. All right. So here's our rationale. The priority in managing a foot ulcer in a patient with diabetes and peripheral neuropathy is to address any infections promptly. Diabetic foot ulcers are at high risk for becoming infected, and prompt antibiotic therapy is crucial to prevent further complications. While the other interventions are important aspects of care, treating the infection takes precedence in this situation. Now, like, what is a hoe? What is it, hoe? What it is, hoe? See, I can't do nothing up in here because you be acting out. You be acting out, Cass. Lord have mercy. But yes, got it right. Yeah, Joanna, you got it right. See, look. You guys got to have a little bit more confidence in yourself, right? So here's a great thing about critical thinking and your clinical judgment. It's like everything has a trend, right? So a sign or symptom of somebody who has diabetes, type 2 diabetes, right? That a lot of times if it's uncontrolled is peripheral neuropathy, right? Peripheral neuropathy is what? Numbness and tingling in the extremities, or especially like in the hand or the hands and the feet, calves, all that good stuff, right? So if I have numbness and tingling and I can't feel it on my foot, right? And then I cut myself, what do you think is going to happen? I'm not going to feel it. The next thing that's going to happen to me is that I'm going to get an infection of some sort. And I'm going to end up at a hospital, and I'm not going to know that I have an infection because I didn't know that I had a cut on my foot. So with diabetics, for all of y'all that don't know, with diabetics, foot care is very, very important. Foot care. Okay? So, and you got to think about it. If I get an infection and it goes untreated, what could happen to me? What could happen? What could I get? Starts with an S. And ends with an S. Exactly, right? You say, yep, you can get septic, you can get sepsis. And then what happens when you get sepsis? I got the beers now. Oh, I got the beatus now. I have no feet. You're so crazy. Staph infection? No, not staph infection. You can get sepsis. You can get septic. Right? Lose the whole leg. Yeah, you'll lose the leg. Your body is compromised. Yep, you will get septic. You will get septic, and if it's untreated, you will die. You will unalive. You won't factory reset yourself. You'll just factory shut yourself down. Right? So that's why it's very important. But you see how the trend goes? What do you guys think my labs would look like? What would my labs look like? What would my okay, how about this? What would my white blood cell count look like if I had an infection? Would it be high or would it be low? High white blood cell count, right? Elevated WBCs, right? Of course, it would be high because now your body is pushing out all these white blood cells to fight this infection, right? Now, here's a question. White blood cells falls under what type of big lab value? No, Trevor, not low. It would be high. So your white blood cell count falls under what great value? Right. CBCs, your complete blood count, right? Because what else is in there? Your RBCs, so on and so forth, right? So imagine if you had an NCLEX style question that was a little bit more difficult than this, and they started talking about somebody who on the NCLEX they give you a case study, something that's similar to this, and one of them is like you show up and he has a cut on his foot, but he doesn't have an infection, right? But then you follow the trend. As I'm looking at his labs, I'm going to be looking at his CBC because I want to know what his white blood cell count is looking like. Is it going high? Is it going low? Right? Does he actively have one? It depending on where he's at with his white blood cells will depend on what antibiotic I give him. What if they give him an antibiotic that's not powerful enough? What if I gave him, I'll just say penicillin, but he needs vancomycin, right? So that's why it's so important for you to understand your content while you're in school and when you're studying for the exam. But then you also understand the pathophysiology of comorbidities that patients have. Does that make sense? If that makes sense, smash the like button, give me thumbs up, let me know something, let me know you guys are vibing, you're picking up what I'm putting down. All right. So if you get into that mindset when it comes to any type of disease process, You're going to be Gucci. You're going to be Gucci out here. All right. Shout out to all y'all. Neighborhood nurse, shout out to you. Got you. All right. How y'all feel about that question? That was a good question. We're on question number 6. You simplified. I appreciate that. I figured out that if it's broken down layman's terms, it's just like once you read it and you understand nursing and medicine or medical lingo or whatever, it's it's so much easier for you to comprehend. I feel like we just make things difficult for just no reason at all. All right. What is that? Is that a Pokemon? That is a Pokemon. That's Sandslash? I don't even remember. I don't even play Pokemon like that. I'm kind of lame now. I just play video games and watch anime. Shout out to anime. Hey, anybody out there watch Attack on Titan? I know this is not an anime podcast or thing, but I'm just saying I'm all about anime. You know what I'm saying? And as a matter of fact, I actually like to, when I'm doing my one-on-ones with people, I actually like to try to correlate to the things that you like. You know, so like if you're a big like wrestling fan, or if you like anime, or if you like shows, you know, or if you like cars, I'm going to be like, hey, so this is equivalent to your car breaking down, or, you know, like, or how they say like watering your body is like having water in your car, right? If you don't have water in your car's going to overheat. If you don't have water in your body, that means you're going to what? Dehydrate, aka you're going to overheat. Does that make sense? Hopefully that makes sense. I hope it makes sense. All right. Shout out to all 31 of y'all that are in here hanging out with me. We are on question 6 of 10 for NCLEX style questions. If you guys are new here, my name is Kevin. Welcome to the TikTok live on this Wednesday. Yeah, we're just hanging out, talking about NCLEX style questions, talking about NCLEX, nursing, pre-nursing, whatever y'all want to talk about. So if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. As well, if you're a brand new nurse, or even if you're a pre-nursing student, whatever, and you want to get prepared for the NCLEX, even though you may be some time away from that, check out the 7-day NCLEX course. That link is in my bio. It's going for $48. It's in the pre-launch phase, which means it is being updated constantly. As a matter of fact, right now, I recorded not right now, but throughout the week, I recorded like 7 pharmacology videos. They're all content videos, as well as I'm working on NCLEX style questions, as well as videos with NCLEX style questions, breaking the videos down for y'all. Okay. Or breaking the questions down for y'all so you guys can better understand it. Okay. But make sure you guys go over there and check that out if that's something that you guys are interested in. As well, make sure you guys follow me on Instagram. Be my friend. Make sure you guys follow me over here. Be my friend. I need 3,000 people to follow me so I can put the question in front of you, rather than me holding my phone looking like this and me trying to talk to y'all. And then my arm getting tired, then I'm annoyed and all that stuff. We don't want that, okay? So shout out to all y'all. Brandy said that this is fun. I'm glad. It says I'm a chronically ill patient. Are you really? I'm sorry to hear that. What you got, Brandy? Tell us what you got. You know what? Because we foster nothing but love and support in this chat. Or so, you know, like if people come in here and they want to talk stupid, they get 600s. And if you don't know what a 600 is, I'm pretty sure somebody in here will update you on what a 600 is. Okay. What is this? Says new, waiting for ATT LPN class to finish. Okay. Shout out to you for finishing. So now you're just waiting. Lupus and Crohn's. You know what? I actually have lectures on lupus and Crohn's. I haven't recorded them yet, but I have them. So the systemic lupus. So for those that are trying to be nurses, like you'll learn a lot about lupus. You know, essentially it's like your immune system is turning around and it's fighting. It's attacking your organs. Like if your organs were foreign bodies, if you don't understand what lupus is, I'm pretty sure Brandy could explain it and articulate it a lot better than I could. So what does it says? Bree says, I'm new here, currently in my last year of nursing school. Shout out to you, Bree, for being here. We appreciate you being here. Amber says, I have Crohn's. You got Crohn's? Okay. Yes, that's exactly what it is, Chrissy. There's a couple of my buddies I work with that end up having Crohn's as well. So, you know. So, Amber says, was it a terrible club? Yeah, it's a terrible club. But hey, you're here. You're here. You're alive. You're hanging out with us. And we appreciate you being here. How y'all feel? Y'all want to do another question? Y'all want to do another question while I over here eat these potatoes and sausage? Sausage. This got cheese on it? Throw some cheese on it. I'm pretty sure that's not how it works. I'm pretty sure that's not how it goes at all. That's not how it goes. Shout out to y'all. All right, cool. We'll do another question. Let's see what we got. I think this question may be a little tougher because you really got to understand what's happening here, okay? All right, so here's our next question. Shout out to all 30 of y'all, but here's the next question. A patient is admitted with severe dehydration and altered mental status. The healthcare provider prescribes IV fluid resuscitation. Which assessment finding should the nurse use to determine the effectiveness of fluid resuscitation? Is it A, increased blood pressure? B, decreased urine output? C, normal body temperature? Or D, improved level of consciousness? How to study for T's exam. I can't focus. T's exam, the Mometrics book. The yellow Mometrics books on Amazon. Check that out. Crystal, you're new. I ain't seen you up here, but Crystal says A. Bree says D. Cass, you say B-O, like you stink, or you say B? BP, or you say blood pressure? Okay. My bad, I was playing. Neighborhood nurse says D. Amber says D. Gabby says D. None of them. Trevor, you got to pick one. Chrissy says D. Okay. Trevor, you can't just be like none of them, because if you don't pick none, number one, you can't go on. And number two, you're gonna fail. A. Daniel says A. Okay. All right. I think the general consensus, like we're kind of all over the place. Well, one thing I know is that nobody picked C. Nobody picked C. Yo, what's up, Rachel? Can you repeat it, please? Look, I usually only do it once. I'm going to do it one more time. Hey, as a matter of fact, since y'all two make me want to repeat this, y'all need to give me the 10,000 likes. Do it now. Do it and do it now. Chrissy says A. Okay, blood pressure. Chrissy, is that your final answer? Is that your final answer? Trevor, you want me to repeat it again? Because I got you. I'll repeat it again. Just got my ARN student membership card today. Shout out to you. Shout out to you. Hey, make sure within the year you go to the ARN conference. Trevor, you say C, A, make A. Sometimes you just got to make a decision and run with it. A good decision now is better than a great decision later. Think about that. No, I need you to repeat it. Okay, I got you. I'll repeat it. A patient is admitted with severe dehydration and altered mental status. The healthcare provider prescribes IV fluid resuscitation. Okay. Which assessment finding should the nurse use to determine the effectiveness of the fluid resuscitation? A. Increased blood pressure. B. Decreased urine output. C. Normal body temperature. Or D. Improved level of consciousness. I will head out. Unfortunately, thank you so much. Pleasure meeting you. Heading to my CBG job. Okay. Shout out to you, Gabby. Thanks for being here. Just come back on Friday. Follow me. And make sure you go over to YouTube, because if you miss it, it'll be there for you. All right. Martine says B. Daniel says D. Chrissy says she's going to stick with C. Oh, I'm sorry. Chrissy says she's going to stick with D. Is this a trick question? No, it's not. These are the type of questions that they'll ask you on NCLEX. I'm a PCA. Well, if you want to be a nurse, these are the type of questions that they'll ask you on your licensing exam, Trevor. Okay. Brandy says A. Oh, y'all all over the place. Y'all all over the place. Now, that actually makes me happy. I'm sticking with improved LOC. Okay, Bree, I got you. I'm saying this makes me happy. I'm saying that this makes me happy is because I go through all these questions all the time, and I'm just like, that's really easy. I wouldn't pick that. But then I go to hard questions, and I'm like, that's really easy. But then I realize if you haven't been doing this, you're not going to know, especially if you're trying to practice to get there. Rachel says A. Is it Mila says A. Okay. So y'all are all over the place. Y'all let me know when y'all are ready. Y'all let me know when y'all are ready. I think the general consensus is all over the place. Okay. Okay. I'm going to go with A now. Okay. Y'all are all over the. Hey, here's another thing I will tell you. Jordan says, what was the last answer? The last answer was improved level of consciousness. Jordan says, A, we're ready. Okay. So here's the one thing I'm going to tell you. When you're taking your exam, 9 times out of 10, your first answer is your correct answer. Go with your gut. Okay. That is. Okay. So I'm just saying, I know you're not. So yes, you're not supposed to change your answer. All right. So here we go. Y'all ready? None of the above. Trevor, I'm going to need for you to figure it out. Okay, sir? I'm going to need for you to figure it out. Vital sign assessment is always good to go. Yes. Never change your answer. Fact. Or C. Trevor, I'm just not listening to you now, because now you're just all over. I know you're trying. But I'm about to give y'all the answer. Y'all ready? Here we go. And if you chose D, improved level of consciousness, you are correct. All right. Now, hold on. Y'all trying to figure out why. I'm going to tell you what it says in the question, right? The nurse is admitting, the nurse is admitted with a severe dehydration, a patient is admitted with severe dehydration and altered mental status. It's in there. It's in there. You can't see it. You can't see it because I'm saying it to you, right? No, I was right before. See, shouldn't have changed your answer, right? So if I had 3,000 people that followed me, then you guys would be able to see it, right? But I'm going to tell you why. Right? It says, will it be change of sodium back in cells to dehydration to improve level? Wait, what? Will it be the change of sodium back into the cells for dehydration? Hey, listen, don't nuke it. Oh my God, I said don't nuke it. Don't overthink it. Okay? Don't overthink it. I'm about to give you the answer right now. It says, in a patient with severe dehydration and altered mental status, the nurse's primary concern is to improve cerebral perfusion and mental status, right? Because if I don't have, what did I say? I even said it, watering your body is like watering your car. When you're dehydrated, everything is going to go up, right? Except for your level of consciousness, which will go down because it's going to go away, right? As fluid resuscitation progresses, an improvement in the level of consciousness is a positive indication that the intervention is effective and the patient's condition is improving. I know I did. I said, dude, don't nuke it. You got to explain that to non-native. I know. I'm not going to sit here and explain to what nuking it means. I can't do that. I don't have the time, nor the patience. All right. So that was a difficult question. That was one of those questions that you're like, man, I don't know, right? You see what I'm saying? And this is what I'm saying. It's just like, was A to improve increased blood pressure? Right? Is it right? Possibly. But which one is more right? What is more important? You see what I'm saying? That's exactly what this exam does to you. And the more that you practice and you sit in front of this computer, because remember, none of y'all took the NCLEX in 94. Maybe Cass did. I'm sorry, Cass. You know I don't mean that. Girl, we Gucci out here. So all of your exams are on the computer. So there should be no reason why you're not sitting in front of this computer studying, or a computer, like a laptop or whatever, recreating the testing center. There shouldn't be anything here. So if you practice the way that the exam is, and then you go take the exam, it's it's not new news. Like you've been doing it the whole time. You see what I'm saying? So think about that. Who said that? I'm assuming you say, how many more questions am I going to do? Well, I'm on question 7 right now. Where's my mouse at, bro? Oh, here it goes. I'm on question 7 right now. I hope to buy an NCLEX for you before I test. My brain works well that way. Exactly. Right. Yep. Should be familiar. Facts. Right. So, Rachel, they got some good ones that are out there, especially if you're ready. And I think you said you graduate soon, or no? Yeah, you said you graduate soon. I remember you told me about that last time. So, all right. We got 3 more questions. May. Yeah, so you got some time. So you'll probably take your NCLEX like June, July of next year. So, hey, I'm rooting for you. Who's ready for another question? Before I do another question, shout out to all 35 of y'all. Right? Welcome to the live stream. My name is Kevin. Welcome to the channel. I go by the Boot Nurse on all social media platforms. And if you're new here, I want to know who you are, where you're from. Right now, we're doing NCLEX style questions. If you don't know what NCLEX style questions are or what that even means, the NCLEX is the licensing exam for RNs and LPNs for them to take their tests, conquer it, and go out there and start taking care of patients. So that's what that's for. Rachel, what does boot nurse mean? Man, I could have swore we talked about this last time. Do I need to give you a refresher? Because I'll give you a refresher if you really want to know, but I know I talked about it last time. So, but I got this question for you, but Rachel just asked me, so I might just have to just wait until she, wants to know stuff. You holding the team up right now. Don't think I was here for that part. I came in late. Yeah, I think you did. So for all those that don't know, the boot nurse kind of has like 2 meanings, like a double entendre, I guess. So the first one is, I never like the term baby nurse. It's weird to me. I'm a whole grown man, but whatever. But in the military, we call people boots. And so boots are people that don't know anything about the military. So they're brand new, but they grow. And in everything that you do in the military, when you move commands or you do all kinds of stuff, like you learn new things every day, right? You're a terminal boot. I believe you. I think we're all terminal boots, to be honest. But so that's where it comes from. It's just like, it means it's just like you don't know anything about anything, but you learn every day. And then the other aspect of it is just like people that don't know anything about the military or are not a military affiliated. If I was to bring out my military boots, they would know that, hey, are you in the military? Right? I mean, most people would know if I had like the nice haircut and how it was shaved, they'd be like, are you in the military? I'm like, no, that like the haircut military nurse sounds dumb. So I didn't want to do that. And I feel like the boot nurse is just something a little bit more unique. So, yeah. And on top of, like I said, with civilians being like, oh, he must be in the military. Or if I walk around in my uniform, which I don't ever do. So I think we're all terminal boots. So it's all good. Does this 7-day training really work for the failed once already? So once again, I don't know what your name is. It just looks like a butterfly. So the 7-day NCLEX course is in its pre-launch phase, which means I'm updating content periodically. And what it does is we go over, which is in the works currently right now. We go over we're going to go over NCLEX style questions, and we're going to go over the 8 sections of the NCLEX pie to include management of care, physiological adaptation, and pharmacology, to name the first big 3. I call those the big 3 because those are the biggest sections on the NCLEX RN. On the NCLEX PN, it's pharmacology, coordinated care, and I think it's basic safety. Safety, that's what it was. So I could be wrong. I got to look at it again. But yeah, so those are what we go over. And that's what the review essentially is going to consist of. There's a whole bunch of stuff that's coming in there over the next couple of weeks. So, and you got to think it doesn't matter what review you have. It doesn't matter what training you have. If you don't apply it, and if you can't change your mindset and and temporarily change your life for you to accomplish this goal, nothing will work. It's a tool. How are you going to use it? And I'm just being completely honest. And this is coming from somebody who failed their NCLEX 3 times, and I passed it on the 4th. I failed it 3 times and passed on the 4th. I've used so many different tools, study plans, and study programs, and they just didn't work for me. It took me to my 4th try to figure out what I knew worked for me, and it took me, a lot of mindset changes and discipline for me to get through it. And then I got the minimum amount of questions, and I was out in a little over an hour when I took the exam for the 4th time. But nobody would ever know that. Nobody would ever know that I failed 4 times or 3 times unless I told you. And that's another reason why I created it. So anything can work for you. Any tool can work for you if you use the tool correctly for yourself. There's a lot of other things that I try to tell people. I was just like, I could give you this screwdriver, but if you try to use it to hammer in a nail, then we got a problem here. You know what I mean? I like new boots. Was a step into the scene like it. I like it. They saying the bearded boot nurse. Okay, it's catchy. Okay, shout out to you, Rachel. I appreciate that. Or standing at a parade rest on Family Day, and all the pictures. I cannot. Amber, you ever been to Fleet Week? I'm just saying. I need your course for LPN. Chrissy, you can check it out. The link is in the bio. And you created it, right? I created it. Yes, I created it. I have a whole curriculum, So, and like I said, there's videos that are going to be going up all the time. So, good for you though, sticking to your guns. Facts. That's what I do. Because I'm trying to take my LPN, but I'm really scared to take it again. I just don't know. I don't know what you're scared of, because guess what? That test ain't going nowhere. It's a part of your journey. It's like coming to a big wall. Right. And that's why when I tell people, I was like, it's not about I was like, you're not just passing your NCLEX. You're not just passing it. You are conquering it. Because I want you to think about it. There was one day where you said, I wanted to be a nurse. Then you put in the work. You put in the work to figure out where to go to school and what to do. You put in the work to get through prereqs. You put in the work to do your entrance exam, and then you put in the work to get into school. Then you got through school. You went through the hell of all those programs, all those mean-ass professors, all the mean-ass preceptors, the stupid-ass tests you had to go through, the exit exams, Then you got all the way to graduation. You were scared then, right? And you graduated. But then you get to the last sliver of this race and you're scared. That journey from where you started to where you are was a lot harder to get through than for you to sit somewhere in a room for 5 hours to take an exam. Right? Think about that. Don't be scared of it. Embrace it. As we say in the military, you gotta, we're gonna embrace the suck and we're gonna embrace it together. When I took my exam and I failed, I was just like, why did I fail? Don't know, and I'm taking it again. Then by the time I got to my third time, I was just like, man, I'm done. I'm not doing this no more. But then I was just like, this can't be me. This can't be me. And I will not allow anybody else to do that. I was a Marine. Hoorah, you were a Marine. All right, I'm done. Not Fleet Week, never deployed. Of course you never did, Amber. But I'm just gonna say butterfly. I'm just keeping it all the way real. It's not just about, this is for all of y'all, all 40 of y'all that are in here. It is not about passing this exam. You conquer this exam because it was a journey for you to get there. Think about like back in the day in the medieval times when they would go and conquer other lands, right? They had to strategically plan that and then journey their asses all the way there, which could be hundreds of thousands of miles. You see what I'm saying? And then they conquered other people. If you think about it on that same concept, that's exactly what you're doing. You start your journey from the beginning and it's a planning and you go all the way through it. And now here you are right in front of somebody else's castle, aka the NCSBN and their damn NCLEX. And now you scared? You wasn't scared to make that plan to walk that ass all the way there. You see what I'm saying? You got to change your mindset. Don't sit here and try to tell me it's my dream to be a nurse. Because if it's your dream to be a nurse, you wouldn't be scared of it because you would want to make it reality. I'm just keeping it all the way real. Shout out to all 41 of y'all that are in here. All right. So my weak point is priority questions. I was so close to it, but I don't know what happened. Okay. So if your weak point is priority questions, guess what? Go back and study more priority questions. But then I kid you not, there's nothing like a quick Google search that can tell you like how to better answer questions, right? And this isn't me, and I'm not telling nobody this just because I say I have a course or I do coaching. I'm just keeping it all the way real. I don't even have to do TikTok. But I like to do it because I like to tell people that, hey, you can get through it. Because if I can get through it, because guess what? That's my degree, and my license is somewhere over there, and nobody has ever come up to me and be like, hey, I heard you failed 3 times. I mean, unless I told them. No one cares. Don't be scared of that exam. No job cares. In the end, nobody cares. All right? All it is an obstacle that's stopping you from crossing the finish line, or an obstacle that's stopping you from getting to the peak of that mountain for you to end up at the summit of another mountain. All right? I'm just saying. Think about that. I'm trying to go back to see what y'all said. I randomly stumbled on this and I'm taking the MCAT on Saturday. Oh my God, I needed to hear this. Well, shout out to you, Lauren. I'm not a doctor, but I play one on TV. No, I'm just kidding. But I'm glad the motivation goes for anybody, not just for people that are nurses or taking the NCLEX. And Lauren, the one thing I want you to realize is that when you go take your MCAT and you eventually become a doctor, don't be an asshole. And by that, I mean, don't be an asshole to people that you work with. Always be appreciative. And I'm not saying that you will be, but you know, like a lot of doctors forget that, you know, people are people, or they forget that, you know, they can't get beat up when they leave the hospital. I'm not threatening nobody. I'm just saying, just don't be an asshole. I know that you're going to go out there, you're going to be a great doctor, and you're going to go out there and inspire the people. It's going to be awesome. He's awesome, guys. I wish I had his course during NCLEX. I'm not a repeat test taker. My weak point, yeah, we talked about that. I'm getting my ASN, and I'm a little older. Rachel, once again, I don't care about y'all's age. I literally just put something on here say like, don't tell me how old you are because I don't care. Because it does not matter how old you are, Rachel. You know that. My ASN works if you want to get into the field tuner. It does. When you're studying chewing gum and then you can't chew gum when you study in the test, I learned. Exactly. So you want to recreate the testing center. They don't allow you to chew gum, can't have your phone, can't have snacks, can't do none of that. The key to passing NCLEX is blocking out all the noise. Facts. Don't overthink it because it's in you. Facts. MCATs, you got this. Facts. All right, so shout out to all. I don't know who I just invited. I wasn't trying to do that. I wasn't trying to do that. I'm sorry. No. It doesn't fucking matter. Doesn't matter. So, shout out to y'all. I got 58 people up in here. Hey, yo, welcome to the stream. Hey, we're about to go over an NCLEX style question. We're on number 7 out of 10. So shout out to all y'all for being up in here. We're going to jump into this next question. I need to know who you are, where you're from. If you're a new nurse, are you taking the NCLEX? You know, I got folks down there that'll answer those questions, whatever y'all got. Nurse Cast got me. You know what I'm saying? So we got a lot of folks that are in here. All right. Hey, I need y'all to share this. And I need for y'all to be my friend. Like, just be my friend because you like me. And give me the 10,000 likes and stop playing games. Massachusetts, ill. Wait, I already knew that, Rachel. I'm just playing. No, but shout out to y'all. I need for y'all to follow me because I need 3,000 likes. 3,000 followers. If I have at least 3,000 followers, then y'all can actually see this. It's not my choice. It's TikTok's choice. I need to have, this amount of things. Yada, yada, yada. This, that, and the third. Hey, I'm taking my prerequisites in NYC. Shout out to the NY. Shout out to the NY. Brooklyn. All right. Anyways, so y'all ready for the next question? Y'all let me know. Y'all let me know right now if y'all are ready for the next question. Let me know. Let me know. Ready. Got it. Cool. Yes. Got it. Cool. All right, here we go. Now, this is a good question. Y'all ready? Here we go. Check this out. A nurse. Oh my God, I'm already fucking up. A patient is prescribed warfarin for the treatment of atrial fibrillation. The nurse provides education about the medication and its potential side effects. Which statement by the patient indicates a need for further education? A. I should avoid activities that could result in injury or bleeding. B. I will monitor my INR regularly as instructed by my healthcare provider. C. I can take over-the-counter pain relief or pain relievers if I experience headaches. Or D. I will inform my dentist that I am taking warfarin before any dental procedures. So which one? What y'all got? Let's hear it. Say C. Okay, we got some C's. C's. You got to put these questions up here. That way, did you not hear me when I said that, Rachel? I need at least 3,000 people to follow me before I can do that. I know. So I said visually. Trust me, I know that this is difficult. But visually, it's there. Visually. Right? I'm just saying. All right, so we got C. We got the general consensus that it's C. Anybody else? How else we doing? Anybody else? No? Well, let's see. Could you repeat the answers? Okay, Alexandra, you get one. Patricia says B. Okay. I'll repeat the answers again. A. I should avoid activities that could result in injury or bleeding. That's A. B. I will monitor my INR regularly as instructed by my healthcare provider. C. I will take over-the-counter pain relievers if I experience headaches. Or D. I will inform my dentist that I am taking warfarin before any dental procedures. All right. Alexander, that was for you. Christy says C. Patricia says B. Okay. Kima says C. Okay. All right. I think the general consensus, I think everybody's done. I think everybody said C, except for like maybe one or two people. Alexandra, what you got? Let's see what you got. Butterfly says C. Okay. What you got? I want to say C. Well, you did just say C. So it's either, is it C? What you got? What you got? Is it Netty Weddy? Sure. Okay. Well, I need a definitive answer. Well, remember when you take the test, it ain't me, it's you. Nettie says C. Cool. All right, here we go. Let's see. If you chose C, I take over-the-counter pain relievers if I experience headaches, you are correct. Warfarin is an anticoagulant medication, and taking over-the-counter pain relievers, especially NSAIDs or non-steroidal anti-inflammatory drugs, can increase the risk for bleeding, right? It is essential for patients on warfarin to avoid medications that can interfere with its effects, and NSAIDs should be avoided or used cautiously, but they should just be avoided, right? Patients should use Tylenol or acetaminophen right? If for pain relief instead. But I wouldn't do that. Just don't use them. But warfarin is a blood thinner, correct? All the other choices prevents bleeding. All right, that was 8. How y'all feel about that one? I feel like that one's kind of easy. The general consensus was C. It's just like C all over the place. C's get degrees. I think Bree said that. Bree, you say that? C's get degrees? I ain't sure. Shout out to all 39 of y'all up in here listening to us. Go over NCLEX style questions. I love it. I love it. I love it. I love it. So, yeah, there we go. So I got another one on here. It's a good one. At least I think it's good. So, but even though these type of questions are up here, this is definitely how you guys should be answering you guys' questions, right? Going through them, reading your question. If you don't understand it, read it again. If you don't understand it again, read your answers. A lot of time your answers the right answer will stick out to you to help you understand the question better. No, I did not, but C's do get degrees for sure. That's true. They do. They really, really do. So shout out to all 32 y'all. Hey, wait, well, hold up. We got 8.8 likes over here. Hey, I need 10,000 likes now, right now. I don't care who does. Hey, give me the 10,000 likes right now. 10,000 likes or I'm not reading another question. Yeah, I'm holding the questions hostage. I'm doing it. I'm doing it right now. Is there a time limit for the test? Yes, it's 5 hours. Alexander, it's 5 hours for the NCLEX. Okay, we got it. Okay, Joanna, go ahead. Oh, Lord have mercy. Oh, Lord. Okay, I see. I just tick, tock, tick. Hey, look, I'm about to eat these potatoes and sausage and see. Turn around and be at like 40K and be like, oh my God, how y'all get me up there? Like TikTok can't keep up with that algorithm. Lord have mercy. Oh my God. Okay, all right. Hey, y'all must really want these last 3 questions. I got you though. But how did you know I'm in Massachusetts? You said it last time. You said that you said that you were from Massachusetts. So shout out to y'all killing that like button. That's what I like to see, yo. All right, here we go. We ready for the next question? 10.7, I love it. Hey, we ready for the next question? Hey, y'all let me know. Y'all give me thumbs up. Tell me yes. You be like, yes, Lord. Y'all can do whatever. Shout out to all 32 of y'all in here. Hey, if you're new here, welcome to the channel. Make sure you guys smash that like button. Make sure you guys like me, be my friend, because I'm cute. You see what I'm saying? If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I don't know why are you giving me the eyebrow? You said it last time you were in here. You were in here on Monday. All right. Here we go. So a patient with epilepsy is prescribed phenytoin to control seizures. The nurse performs a drug level check and finds the patient's serum phenytoin levels to be 30 micrograms per milliliter. What should be the nurse's immediate action? Administer the next dose as prescribed, hold the medication, and notify the healthcare provider about the elevated levels, discontinue the medication immediately to prevent toxicity, or D, assess the patient for signs of medication non-adherence. All right, let's see what we got. Got my ATT. You say B. Okay, B. Got my ATT. Hold on. Brandy says D. Still studying for NCLEX. Okay, is that Nemo? In my last year of nursing school, Dina. Shout out to you, Nisa. Dina, you're gonna do good. B, but I don't know. But I don't know the levels. Okay. Callie says B. Notify healthcare provider and hold meds. Is that a Calliope? Yo, Calliope. Why does that name sound so familiar? God of War. That's why. What's it? B. Say answers again. Chemo. I'm gonna need for you to keep up. Yes, you said it right. Okay, got you. D and B or D and B? You pick D and B? You can't pick both. You got to pick one. C or B? Hard question for me. No problem, Joanna. The hard questions are the ones that are just going to, those are the ones that they don't make or break. Hey, so that's another thing, too, that everybody needs to realize is that when you take your exam, it is what we call a computer adaptive test. So the computer adjusts to how you answer. So if you answer a question right, it's going to give you a slightly harder question. Right? If you answer questions wrong, they're going to give you easier questions. Okay? So think about that. And you'll know when you start getting an easy question when they start asking you, what is the normal blood pressure of a patient? Or what is the normal blood pressure range for a patient? You're going to be like, why would they ask me that question? That's really easy. If you start seeing questions that are that easy, you're going to be like, you better start rethinking. You better start like slowing down and really paying attention to what they're asking you. I may have had that come into Jesus moment 3 times. I'm just saying. So it looked like the general consensus was B. The general consensus was B. Some people said, who said A? Or somebody said D. And somebody else said A or C. Dina says B and D. Dina, you cannot pick both. You have to pick one. Pick one, Dina. So does the NCLEX start off easy too? So the NCLEX starts off like mid. Kind of like the kids nowadays. They say mid. It starts off like mid. Angel says B. Okay. So, here I'll give you a better answer, Calliope. So everybody, when you start, everybody is above the passing level. That just gives you more clarity. Everybody is above the passing level. After that, Jesus, take the wheel. And by that, I mean you, because you're going to be fine. Don't worry about it. I mean, do worry about it. So, okay, gotcha. That makes sense. Yeah, for sure. All right. Everybody ready for the answer? Everybody ready for the answer? The best thing is like when you do get the answers, it's not just about the answers, but the rationales of why it's so important. What, Rachel? What did I say? All right. Here we go. If you chose B, hold the medication and notify the healthcare provider about the elevated levels, you are correct. Shout out to y'all for everybody that got it correct. But here is why. A serum phenytoid level above the therapeutic range, which is 10 to 20, and it was at 30, right, places the patient at risk for medication toxicity. The nurse's immediate action should be to hold the next dose of phenytoid and notify the healthcare provider about the elevated levels for further evaluation and possible adjustment to that medication. Right? So you need to know why. Okay, obviously, this is why it's good to know the ranges. Because what if I would have gave that med to that patient? Again, toxicity, could die. You know what I mean? This is why I've always said that the NCLEX wants you to think like a safe nurse. It's all about nurse safety. Even though you need to know about, the nuances of the things in your content to apply to the questions, that right there is a safety issue, although it is a pharmacology question. Does that make sense? I hope that makes sense. Shout out to all 38 of y'all. Death. Yes, definitely is death. Dina's following me. Shout out to you, Dina. Shout out to you for following me. Now share it. Share it to hey, how many people I got here? 35? I need to see 50 shares right now. Right now. I don't care how many times you got to share it. Share it right now. Share it right now. Let's make it happen. I need folks to know. And by the way, if you know somebody that needs this or they missed this, tell them to go subscribe to my YouTube channel. And if they subscribe to my YouTube channel, they'll get this video. They'll get it'll be up there all 2+ hours of 2.5, almost 2.5 hours of it. I'm just saying if they want to sit here and just listen to me talk. Oh man. So how did y'all feel about that question? Did you feel it was easy? Did you feel it was hard? I know people start just spitting them out. So you guys let me know, because that kind of tells me what kind of other questions I need to throw in here at y'all. So y'all let me know. And also let me know if y'all are ready for the next question. And if you're ready for the next question, cool. Pretty easy. Amber says easy. All right. I'm surprised I got it right. Okay, Callie. It was middle difficulty in my opinion. Okay. So Amber says it's easy because apparently Amber just know everything. You know what I'm saying? No, I'm just playing. But, for some people it's easy. For some people it's not. But Amber has been, you're in the patient care tech role. So may have had some exposure to it, Santiago, you got the brain, my guy. I see you. I'm overthinking and ready. Okay, you don't even need to overthink. I'm ready for the next question. I missed this one. Okay, I got you. Apparently the next gen tells you if levels are high or low. Don't need to know the lab, supposedly. You do need to know your labs. They give you your labs. And if they do give you your labs, they'll tell you what the ranges are. But you got to also think about it. Like if the labs are too high, what is your clinical judgment going to be after that? You know what I mean? Like what decision are you going to make? Even though they'll give you the lab values, as in like, potassium is 3.0 to 5.3, right? But okay, I give you a potassium of 6. All right, cool. What's that EKG going to look like? Okay, if the EKG looks like that, what cardiac medication could I give to break somebody out of, AFib or atrial flutter? You know what I mean? So, and hair by 3T, 3.5, 5.0. You'll see other ones that'll be 3.0 to 5.3 or whatever. So, but on a grand scale, as long as whatever those lab values are. I remember when I took my test, it said like 3.0, and I was like, whatever. And I had books that contradicted that. So, and on NCLEX, they're not going to ask you like, those ones that are like super close, right? So if I gave you the potassium at like 5.1, you would be like, whoa, that's above the range, right? But then like other like literature contradicts that, right? But everybody knows that if a potassium is at 6, that is not good, right? Everybody knows that a potassium in the 2s is not good. You know what I'm saying? Oh, Chris, you're nice. Is it because I look like Jason Derulo? I don't sing like him. Girl, you the one. Anyways, we ready for the next question? Hey, make sure y'all share this. Make sure y'all be my friend, all of y'all. I want y'all to be my friend. All right? Community, baby. That's what I'm about. Hey, we already said we're ready for the next one. Is ATI harder than the NCLEX? Yes, it is. All right, here we go. Next question. Right? A nurse is assessing a neonate born to a mother with gestational diabetes. The neonate's blood sugar levels is 30 milligrams. Or I'm sorry, 30 milligrams per deciliter. What is the nurse's immediate action? Is it A, administer IV insulin to lower the blood glucose level? Is it B, administer glucose IV to increase the blood glucose level? Is it C, initiate the neonatal resuscitation due to severe hypoglycemia? Or is it D, administer subcutaneous regular insulin to the neonate? How old is the baby? It's a neonate. So baby's probably like what? Like a day old or born prematurely? Say B. B. B, B, B. B, yes, B. Okay. What was C again? C was initiate neonatal resuscitation due to severe hypoglycemia. I just want to let y'all know you're essential. God bless me says C. Okay. D, don't like this one. Okay. So you say D. So you don't like this one, Chrissy. I got you. So you say administer subcutaneous regular insulin to the neonate. Got you. All right. So this is where it's super important that you know your content. Like, hey, what is a neonate? What does a neonate look like? D. You say D, Rachel. Okay. What does a neonate look like? Who can get gestational diabetes? What is the normal blood glucose levels for a baby, right? And then what should you do immediately? What does somebody look like when they have a glucose rate or a glucose level of 30? Kima says D. Calliope says D, right? And so what should be your immediate action? What should I do? What should I do? Okay. So we say D. So I've had a bunch of y'all said, okay, I had a bunch of people say I got some B's, a B, a C, a D. Nobody picked A. Hey, so here obviously I kind of gave that one away for A, but what does insulin do to blood glucose? What does it do? And this is not a trick question. And I literally have to ask this question because I've asked some people, I was like, what does insulin do? Yes, it lowers. I literally have had many, and I mean many people says, it raises the blood sugar, right? And I'm like, wouldn't give insulin to a hypoglycemic patient. Yes, you definitely would not do that. Because what are you going to do? You're going to lower it some more, and then, you're going to have, then you're going to literally put them in a hypoglycemic shock, right? Insulin lowers, right? 100%. So A, it was automatically out the door. If somebody was up in here picking A, I would have been like, hey, come on, we gotta have a conversation. Come on now, But it said, if you don't know, hey, but here's the thing, you don't know what you don't know, right? If you have a content gap, and meaning like there's something that you don't know, this is the perfect time for you to take a note and be like, oh man, there's something about diabetes I don't understand. Maybe I should go do a little bit more research, right? Remember, it's you taking this exam, not me. I've taken mine 1, 2, 3, 4 times. You see what I'm saying? We are all right. So we ready for the answer? We ready for the answer? All right, cool. So the answer is, Juju said, hi, I'm from Florida. What are we talking about? Sorry, just joined. We're talking about NCLEX style questions. That's what we're talking about right now. All right, so the answer is B, administer glucose intravenously to increase the blood glucose levels. Right, IV is the quickest way for hypoglycemia. Yep, 30 is really low, right? For sure. Yes, it is. Right? How many questions are on the test? It depends. If you're taking the RN, it's 85 to 150. D was given insulin, right? Correct. D was given insulin. But let's see what D. We'll go back over the questions, or we'll go over the answers again, right? So obviously, I'm not going to go over A because we talked about that one, right? But B says administer the glucose intravenously to increase the blood sugar or the blood glucose levels. That's what we determined, right? So once we determined that, C was to initiate the neonatal resuscitation due to severe hypoglycemia, right? That's not the most important thing to do. And D was to administer subcutaneous regular insulin in a neonate. Now, there are two things that are wrong with that. Who can tell me the two things that are wrong with answer D? Who can tell me? Insulin lowers. They are already low. That's true. That's true. So it's subcutaneous. Right? Can you give regular insulin subcutaneously? Can you give regular insulin subcutaneously? Yes. But what does insulin do? It lowers, exactly. So that's why we would not want to give it to that patient. Somebody asked me what was the normal blood glucose for a neonate. I think somebody asked me that. Let me see. What is the best NCLEX RN prep course? It all just depends. Honey love, it all just depends on what you want. It's 80 to 90, I believe. Yeah, 80 to 90. I didn't go all into detail like that, but yeah, I believe it's 80 to 90. I don't work in peds. I'm just saying. Nope. Regular insulin can be given subcutaneous and IV. Yes, it sure can. But it's still insulin, right? So we don't want to give it at all. What unit do you work in? I work in the operating room. Somewhere that Rachel wants to go and work. You're going to get there, Rachel. All right, so I'm going to read the rationale for you guys. Neonates born to mothers with gestational diabetes are at risk for hypoglycemia due to the abrupt cessation of maternal glucose supply. A blood glucose level of 30 is critically low and requires immediate intervention. The nurse's priority action is to administer glucose IV to correct the hypoglycemia and prevent potential neurological damage. So what will we give? So if we're going to get something IV, which is glucose, what will we give? What free NCLEX study questions can I find online? I mean, there's so many. There's a lot out there. I'm in CRNA school. Shout out to you. Shout out to you being Ashley at CRNA school. I was going to do that, and then I didn't. So that's not that ain't the way for me no more. What free? Yeah. So what can we give? So we're going to give some. What was the question? So it's like, okay. So it says right here that we're going to give glucose, right? What are we going to give? Yeah, we can give D50, right? Has anybody in here ever given D50? Can you give me your top? What are you talking about? Talking about this? Where it says I'm essential? Hold on, let me see something. Ain't nothing that a little Google can't fix because I'm trying to see something else. All right, there we go. I shot on the anesthesiologist in the OR and immediately knew I'd never be a CRNA. Look, I don't know what it is. D5 is or D50 is dextrose 50. So essentially, all it is honestly it's sugar. That's just all that sugar is going straight into your vessels. And if you look, that's all it is. And when I tell you that shit is hard to push in, it is hard. Like I ended up having like imprints in my hand one time because we were giving somebody we were giving them steroid injections, and of course that increases their glucose. So we were giving them insulin, not fucking steroids, because steroids increase it, and we had to give them insulin. But do you have any tips to manage POTS or play sports with POTS? I don't know what is POTS. What is POTS? POTS is not ringing a bell right now. It's thick, straight up with 2 C's. Straight up with 2 C's. All right, we're on our last question. Question number 10. Last question. All right, how are we feeling out there? Shout out to all 42-year-olds that are all hanging out in here with me. Going over NCLEX style questions. Postural, tachycardia syndrome. What about it? Honestly, I haven't even like looked that up in like I don't know how long. I actually would have to like look that up. Like, I'm wanting to tell you, like, look, if I ain't seen it in a long time, I have to look it up myself and be like, oh, okay. And even as a nurse, there's some of those things that you're never going to experience. So I'm just like, oh, orthostatic tachycardia syndrome. Oh, I definitely want to look that up now. So, all right. So shout out all 39 y'all in here. We got one more question. If you're new here, talking about NCLEX, talking about nursing, I go by Kevin, the boot nurse on all social media platforms. That's on Instagram, of course, TikTok, a Thread. I also have X. I didn't have it. I got it back for some reason. I don't know why. So there's that. I want to know who you are, where you're from. We're going to go over one more question and then I'm going to get off here because, your boy got stuff he got to do. So, I want to know who you are, where you're from, if you're new here. And I also want to know where you're at in your NCLEX journey, or your NCLEX journey, your nursing journey. Like, are you a nursing student? Are you a pre-nursing student? You want to be a nurse? Did you graduate? Have you taken your licensing exam yet? Are you an RN student, LPN student? Are you an RN or an LPN? Let me know down in the bottom. I'm new and I live in Atlanta. Shout out to the ATL. It's expensive there now. I ain't trying to go. I had a POTS episode and went to the ER. Was scary. Have you been diagnosed? Have I been diagnosed? Oh, you're talking to her. I thought you were talking to me. I was like, no. You asked me about respiratory therapy. If you like, doing respiratory, if you like airways, I met so many RTs, like they're great. I'm a firefighter and I start my RN program soon. Glad to have seen your page. Hey, shout out to you. I'm glad that you're here, man. I'm glad you found it. I'm in Miami. I take my NCLEX next week. I'm scared. Well, don't be scared. If you're preparing for it, you're going to do all right. Tara Mississippi, admission advisor for SON. I don't know what that's. Is that Students of Nursing or School of Nursing? Hello from California. Shout out to Cali, right? All right, here we go. Shout out to all 36 of y'all. Hey, give me the 15,000. Give me the 15,000 likes right now. 15,000 likes. Amber, where you at? I know your finger hurts. Make it happen. You're in charge of that. All right, cool. Hey, we got one more question. And we will see. I think this is kind of reminds me of the other question. I think it'll do great though. Got you. I appreciate it. All right, here we go. Last question. All right. A patient is prescribed a continuous IV infusion of dobutamine. The nurse should closely monitor the patient's what? Is it A, creatinine levels, B, potassium levels, C, blood pressure and heart rate, or D, oxygen saturation and respiratory rate? Let's see. Let's see what you got. Let's see what you got for those folks that are in nursing school and that did pharmacology. Let's see what you got. First of all, tell me where does dobutamine fall under, like in pharmacology, for those that have done it or used it or been through pharm or whatever. You say D? D? Okay. Well, this is a good one. BP? So you say C? Martine says B. Okay. B. Are you still online? Dang, I'm about to, hey, look, I'm on my last question. Is it Candy? Candy says C, which is blood pressure and heart rate. Okay. She made like potatoes and sausage and some other stuff over here. It's good too. Yeah, I'm still over here. Gotta watch BP with it. She said gotta watch that BP. Joanna says C. Okay. Are we talking about sepsis? No, we're talking about dobutamine. A patient is prescribed a continuous IV of dobutamine. The nurse should closely monitor the patient's what? Creatinine, potassium, blood pressure and heart rate, or O2 sat and respiratory rate. All right, I think we're doing. I think I see the general consensus. A lot of people are saying C. A lot of people, some people are saying B. Some people said D. Okay, so we got a good mix. Bree says D. Dr. Anita Farm D says that Farm D. You know what? You can't even answer. No. You can't do that. That's cheating because you already know. You already know what the answer is. You say C. Say C. Yeah, I could be wrong. I could be wrong too. I don't think I'm wrong. I always like to double check my work, and I don't think it's wrong. So shout out to y'all. Hey, we ready? I think everybody's answered. Shout out to all 43 of y'all. If you guys have just jumped in, we're going over NCLEX style questions. Scott says C. All right, Scott, Mr. 49ers. We'll see if you got it right. All right, let's see what the answer is. Here we go, right? If you chose C, blood pressure and heart rate, you are correct. Dobutamine is a positive inotropic agent that stimulates the heart to increase cardiac output. It primarily affects blood pressure and heart rate. Monitoring these parameters is crucial to ensure that the patient's hemodynamic stability during the infusion. So if you picked C, you're going to get a degree because that's what Bree says. No, but shout out to y'all. So the answer was C. And that's all 10 questions, y'all. That's it. That's all we got. How'd y'all like that? How'd y'all like us talking about NCLEX style questions? I picked C and I have a degree. Shout out. Me too. Cause I already knew what the answer was. So how often do I go live? I go live every Monday, Wednesday, and Friday, between 5:30 and 6:30. It's actually been a lot better. I've been very consistent for the last month. So, Amber says, love this style. Shout out to you. And of course, Nurse Nelly is here. She is my wonderful co-host, right? She had to go do some stuff, with baby girl trying to learn biology and all that good jazz. So, Martine, hey, 15K, that's what I'm talking about. I appreciate y'all. I appreciate all y'all. But yeah, so that was actually my first time doing NCLEX style questions for y'all. So it's been widely requested, and then Thunder did something, and I was like, sure, whatever you want. So y'all thank Thunder for that whenever Thunder decides they want to pop back up. Did you say the answer? I did say the answer, Candy. It is blood pressure and heart rate. Love the rationales, make it easy to remember. I'm just saying there's no need to make things harder than it already is. Nursing school is already hard. Well, getting into school was already hard. Nursing school was hard. The test itself in all its entirety, just the whole thing is hard. Studying shouldn't, I don't want to make it hard for nobody. We love consistency. Look, I'm trying to be consistent. I'm trying to be as consistent as possible. Shoot, I learned a lot. about bio tonight. I know, like it's like, are you smarter than a fifth grader because you forgot about all that? Do you do NCLEX? Do you do NCLEX questions every live? I enjoy this. I don't. This was actually my first time doing it. Yes, Candy, you were completely right. And if you didn't hear the rationale, I'll say it again. Dobutamine is a positive inotropic agent that stimulates the heart to increase cardiac output. It primarily affects blood pressure and heart rate. So monitoring the parameters is crucial to ensure that the patient's hemodynamic stability during the infusion. Okay, I did forget about all the basics. I mean, if you're not a scientist and trying to be anything else, who's going to really remember biology, right? But shout out to all y'all. I'm glad that you guys like the questions. I think I might actually start incorporating, bringing people on as guests as well. Kind of like doing like a live podcast type deal. How would y'all like that? Like we bring on like other nurses that have been on here, talk to some students, who are essentially currently like where you want to be, if that makes sense. Actually, you like that? Okay. All right, cool. I know I had asked this last time and a lot of people were just like, yo, let's really do that. So, but I think right now bringing on nurses that are already in the field to give their perspective of where they are to nursing students as well as pre-nursing students, I think that would really, really work out. Right. And we definitely can do that. And so I already know who my first guest is. I'm not going to tell y'all who it is. They already know who they are. And we're going to set aside a date, and then I will talk about that in the next live. That way people can just pretty much pick up on what's going on. So, yeah, I think that, let's see what you got. Make sure it's people you're cool with. No stuck up rude people, because there's a lot of them on TikTok. No. Hey, what did I tell you? Y'all already know the deal, right? Nobody's going to come into my chat. I got co-hosts for that. You know what I'm saying? Like, you ain't going to come into my chat and act like a fool. And I'm not going to invite you on somewhere so you could feel like you have your 15 seconds of fame. Like, if there's a purpose for you to be there, right? And if not, you can get a 600. And y'all already know. Y'all been here long enough to know what a 600 is. If you don't know, start asking folks. Okay? Like, I don't do rude people. Like, cause y'all see that? Like, that the military in me will come out real quick. I'm like, hey, why are you here? If you decided you want to come over here and complain. And that's another thing. I don't do complainers. I don't do people that come over here telling me about all their problems. And when I'm talking about all your problems, I'm just like, don't come over here making excuses for why stuff doesn't go your way, because that's all your fault. Everything is your fault. Remember that. Everything is your fault. But then the question I'm going to follow with that is, how are you going to fix it? How are you going to fix it? You have a lot of problems? Oh, don't I know it? Me too. You see these bags under my eyes? You see what I'm saying? No complainers or negativity is my motto this semester. That's what I'm saying. Rachel, you and I talked about this last time. I was like, stay away from folks. If you need to be secluded in a corner for you to do you, do you. We don't have time. Come with a resolution to the problem. That's what I'm saying. If you're going to come to me with a problem, you better come with a solution. You better not come over here complaining. I can't pass my NCLEX. Hello. Yolanda. I don't know what prompted me to say that, but don't come up. Everybody knows I don't coddle. I don't come up with the excuses. And if you come up with a problem, you better have a solution. Don't come over to me and tell me that you failed your NCLEX and you quit. I'm gonna be like, all right, cool. Then I guess you'll never be a nurse then. Oh, it's been my dream. No, it's not. You're right. It is a dream, and it'll never become a reality because you want to quit. I don't do quitters over here. I don't. So, if anybody wants to be a guest, you got to come correct. And you got to be ready, because we don't coddle around here. Because if you come up with the excuses, I'm telling you right now, nursing is not going to be the deal for you. That's what I'm saying. All that money wasted on top of that. I have literally seen people go to nursing school, get through it, and then let something as small, and I say small, although powerful, small as the NCLEX stop them. Because it's the mindset thing, but stop them. They're like, I haven't been to nursing school since 2004. And I'm like, you haven't what? They were like, yeah, but it's my dream. And I was like, yeah, and that's all it's been since 2004. A dream. I was like, but now, if you want me in your life, you can't be coming to me if you come to me with dreams, you better have a plan to make it a reality. You see what I'm saying? Nursing is not my dream, but it's going to be cool. That's what I'm saying. Because nursing can fuel you to get to where you want to go. Rachel, you already know what's up. You know what's up with that. Sharp Knight says cool motivation. Hey, it's what I do. I ain't with the games. I ain't with the BS. It's just like if you about, as I said, if you about this life, you better be about this life. This nursing life. I don't know where that came from. I'm about to excuse myself just for doing that. Shout out to all 43 of y'all in here. I love it. And it says, you get so many chances to take it. No reason to give up. Facts. Not only do you get so many chances to take it, if you don't learn from the previous mistake, that's kind of like how it is in life. I'll give you an example. If you keep going back to the same person that is physically abusive to you, then you have learned nothing. If you keep going back to the same person who is mentally and verbally abusing you and you know won't change, who is holding you back, then you have learned from nothing. I don't believe that people change. I believe that people evolve. It's because something that happened to you in your past is a part of you. It helps shape you. But if you're that way, if you were that way 5 years ago, and then here you are 5 years later, and you're the same exact way, you haven't evolved, and then you remain a problem. And if that's the type of person that's in your life, I suggest that you reevaluate your life. AKA, if you have not found a reason or found a way to change the results that you got, and then you go 5 years later and you're still getting the same results, obviously you're doing something wrong. So I would suggest that if you're doing something wrong, that you fix it. Because we all about evolving around here. We bout it. I'm just saying. I'm trying to live in a 2-income house, but alone. Facts, right? How do I stay motivated? I'm not even gonna lie to you. You see that? Not him. I mean, he's cool too. But you see that right there? Not those, because that's my fan. Those are fans that I have to put up that way. Right? You wanna know how I stay motivated? It's that board right there. Like literally, I stood in front of this board, and I mean it, probably about an hour, and I just wrote down everything. And all of those are all the things that I want to accomplish before I'm factory reset, or I'm shut down, or whatever the fuck you want to call it, right? That's how I stay motivated, because those are the dreams that will be my reality. To include teaching, coaching, I guess a master's degree, I guess maybe a PhD, whatever the fuck. And then, I live for other people. I live for me. And by me living for me, I live for them. You know what I mean? So that's how you stay motivated. It's just like, what is something that is bigger than you? And honestly, you know what I really, truly love and what keeps me motivated is y'all. Like, not all 32 of y'all, but maybe like the other couple thousand people that like me, I guess. But I get such joy of helping other people like accomplish this goal that I felt I had such a struggle on. Like, I remember somebody that was just like, hey, do you think you'll ever have an I made a moment? I was like, I have an I made a moment every time I impact somebody some way, shape, or form. I see nursing students and PCTs at work all the time, and they're like, I'm about to start nursing school. And then instantly it's like, I get excited. I was like, hey, I have a suggestion. Would you like to hear it? Because sometimes I can get really abrasive and I get excited. So I'm just like, hey, so I have a suggestion. Would you like it? They were like, yeah. And so next, I give them all these YouTube channels that I used, all these other things that I use. I don't say nothing about my course. Because it's not about me. It's about them. It's about you. It's about where you are. Do I say it here? Yeah, of course, because I can do that. But if I saw you in the street, I would be like, hey, you should look at this. You should look at that. Look at these YouTube channels. You look at that. Look at this book. Look at this program. I say motivated because I know what my purpose is, and my purpose is for other people, like nursing students and people that's trying to accomplish this dream, trying to conquer that exam. That's what it's all about. I do it so my husband can be a stay-at-home dad. Hey, shout out to that. That's what I'm talking about. I bet you love being a stay-at-home dad too. I couldn't do it. I would lose my mind. I would lose it. Bro, I'm badass. ER that I had 5 years ago. This most important lesson in nursing is you're putting God first, family. Yeah. Let's see. Respect to you nurses out there. I have nothing to do in the medical field because I can't remember. Yesterday, Army. Oh, that's Navy. It's Navy. Cool sailor. Just me being honest. 30 years RN. Shout out to you, Christine. Oops. 30 years RN. Put God first, family, then a job. Oh, I don't put a job before nobody. I don't put a job before nobody, because there's so many jobs out here. So many jobs out here. And trust me, and best believe when I tell you a job will replace you. So be honest. How do you feel about DC? I don't know. Oh, you're talking about like the DC Comics, or like Washington DC. Last semester of LP in school. Shout out to you. You're gonna kill it too. Go out there and kill it. Millennial talks. I don't know. What do you mean, DC? I like DC. Batman's gangster. I love him. Last time I talked to you, I was preparing for the NCLEX iPad. That's what I'm talking about. That's what I'm talking about. Michael. Hey, Michael, look. Hey, talk it. Talk it down in the chat. Everybody, all 42 of y'all give Michael some love right now. All 42 of y'all give Michael some love for passing the NCLEX and tell him to welcome to the shit show. Because that's what this is. It's greatness and shit showness. But I'm telling you right now, people don't realize that how hot of a commodity a nurse is. And I'm not just talking about nursing school either. I mean, I'm not just talking about working in a hospital either. I'm telling you, there's so many things that you can do as a nurse out here. It is unreal. There's so many things you guys can do out here. You can go do medical devices, medical sales, pharmaceuticals, work at insurance companies. Freaking go be a school nurse if you want to, or freaking go be a nurse on a cruise ship, be a travel nurse, an international travel nurse. You can go work at SpaceX, in the military, freaking be a public health nurse, community health nurse, flight nurse. You can do all that stuff outside. Case management, data utilization. You could there you go. Aesthetics. You want to go pump somebody full of freaking lip injections and fillers and Botox. Hey, if that's what you want to do, cool. You can start your own business. You can do so many things out here. And I'm just keeping it real. You can, I know there were nurses that I worked with in the ICU that were married, sold their house, bought an RV, and all they do is travel. Sharp, it all just depends on what type of nurse you're trying to be. If you're trying to be an LPN, it could be as short as 10 months, as much as 14 months. And as an RN, if you get into nursing school, depending on what school you go to, it can be anywhere from 2 years to 4 years. It all just depends. So Ashley says goals. Ma'am, you're going to be a CRNA. You're about to go make the most money out of any nurse anywhere. So, but then again, you could... you already know those travel contracts look real good for CRNAs. I'm just saying, making like $100K a month. You know what I'm saying? Is nursing school hard as it? What? Oh, is it as hard as it is rewarding? Yes, it is. There are, as a matter of fact, I'm going to show you guys a book. So here's this book that's right here. Okay, it's called Nurses. I want all 43 of y'all to see this. This book is called The Nurses: A Year of Secrets, Drama, and Miracles with the Hospitals, or with the Heroes of the Hospital. Right, and I really like this book because it gives you the good, the bad, and the ugly. And it has a lot of just really terrible stories of things that happen to nurses. Everything from racism to being addicted to medications, a woman trying to do IVF and have a baby, some Grey's Anatomy shit, it's crazy. But I recommend this book. I recommend every nurse should have this book, right? And it talks about at the end, how rewarding it really is to be a nurse. No matter if you leave bedside or anything, there's something about nursing that you can't get away from. There's something even me, when I finally leave bedside, I will still be able to impact other nurses, because that's what I want to do. Is because we have to give back to our own, because eventually the newer nurses are going to replace us, because eventually you're going to retire. Eventually you're going to leave. You know what I'm saying? So I think as hard as it definitely is rewarding. So no #fake nurses. I'm a non-invasive beauty girl. Okay, I got you. But I will invade others' faces, no problem. Okay, shout out to you. To be able to travel. Yep, you can travel as a CRNA. You know that. It took me 2.5 years, but that was fast. Busted my ass. That's right. Travel nurse sounds cool but scary, I think. So here's the thing: is if you do decide to become a travel nurse, my recommendation is that you do at least a year before you travel. Maureen, my peds class, I actually didn't mind peds. I thought peds was cool. I have that book. It's a good book, Michael. It is a good book. Locums are rough, but pay well. They are. So the thing about the travel contracts is like when you're a traveler, since you make so much money, the hospitals, they give you the shittiest patients. They give you the shittiest just everything. The author is Alexandra Robbins, Joanna. I'm enrolled in pre-nursing, but worried I'm not smart enough. Oh, here we go. Do you have thoughts? Do you have those thoughts too? No, I don't. User 19. I'm going to tell you right now. If you have thoughts of not being smart, then I'm a firm believer of putting everything out into existence. If you say it, it shall be so, right? So if you're saying out loud that you're not smart enough, then you're not going to be smart enough. So that's a mind shift. That's a mind shift change that you need to do for yourself. Like you need to speak positive words of affirmation. You do. I rarely tell people what they need to do. However, it's like if you want to be a part of something that could be very difficult mentally for people, you have got to change your mindset. Listen to more positive things. Keep more positive people around you. Whoever's negative, get rid of them. Get rid of them. And here's another tip. Just because they're family doesn't mean they're good for you. I'm just keeping it in stat. Just letting y'all know. My peds class was amazing, but I love working with children. Not everyone likes it. That's right. You double rock. I appreciate it. I do love peds, but I wonder what the class are like. Peds is cool. What made you all want to go into nursing? Will you do an educator MSN? Yes, Rachel, I am. That's exactly what I'm going for. My mom said I was a mini you because I edited a video. You are a mini me. What else we select? Oh yeah, that sounds correct. Do 1 year. Yep. Thanks. You got to go in with a can-do attitude. Facts. You sure do. You have to go in there with a can-do attitude. If you don't, I'm telling you, if you don't, you think school will be tough for you. The profession will chew you up and spit you out. Not saying that you got to have tough skin or any. I mean, you do have to have tough skin. You know, there are a lot of great people that are out there. A lot of great nurses that are out there as well. So what it said, write down your title, i.e. Jane Doe RN, tape it to your mirror. It will come to fruition. Facts. I used to do that. I put Kevin Gibson RN all over everywhere. And then I even answered it. I put Kevin Gibson RN and I put a question mark. And I'm like, fucking right, I will be. Shout out to all 42 of y'all listening to me run my mouth. All right. But remember, we don't come up in here with excuses. I don't think I'm smart enough. Okay. If you don't think you're smart enough, change your mind. You have to change your mindset. You really, really do. Okay. Kevin, what's your specialty? I work in the operating room and I specifically worked in general surgery and OBGYN working with the Da Vinci robots. That's where I worked. But I am working on getting a teaching job so I can be an adjunct instructor or something along the lines of that. So I can teach. I think I would be an okay teacher. What y'all think? Is the OR a lot of money? Well, Cyrus, it just depends. Depends on where you go. Can you give work advice? I get really bad anxiety for hours after work. JJ, do you work as a nurse? And if you work as a nurse, how long have you been working as a nurse? And because that can determine like if you have imposter syndrome, because imposter syndrome is a very, very real thing, not just in nursing, but just in professions in general when you first join them. So I just studied my ovarian case. Crazy, right? You would be an amazing teacher. Thank you. Xanax. Oh, Lord. Ma'am, we're trying to not go the medication route. If you don't have to get on medication, don't do it. Amber, you are not. Don't do that. I'm a prison nurse and I love it. Corrections is the hidden gem of the field, I believe. Well, I mean, if Cass was here, she would tell you the same thing. And of course, I already know that Amber's about to agree with everything that you just said in regards to the prison nurse. I, for one, don't do prisons. I don't do prisons. So, But like I said, you can work. There's so many places that you guys can work. Like, I didn't even know. Did you know that you could be a nurse and you can work for the post office? Like, everybody ever seen that Barbie meme? She's like, I'm just saying, I did ADHD meds when I started and ended up in the ER for heart issues. Don't do it. Yep, these people are wearing me out. Trauma nurse here. Hey, Heather, you already know what's up. If those people are wearing you out, it's time to leave. We need more color in the field. I think you should teach. I love teaching. The post office, really? Yeah, for sure. I'm an allergy nurse and I love it. Look. So you just work like in an allergy clinic or like a dermatology clinic. Oh, that's another thing. You could be a clinic nurse. Like, go work at a clinic, or you want to go work at an urgent care, or hell, I think at one point they were just had people that were just giving immunizations, like when COVID happened, and they were paying stupid amounts of money. So what have you heard about military nurses? I don't know. I've been in the Navy 16 years, Cyrus, and all I've ever done was work with military nurses and military doctors and surgeons. So I know a little bit. A couple of years, and I'm going back to school. Eventually, I want to be a nurse practitioner. So you need just a year. Get a year in the area of where you want to work. So if you want to be an acute care nurse practitioner, or if you want to do ER, or if you wanted to be a family nurse practitioner, psychiatric nurse practitioner, they got nurse practitioners for everything. So if you want to do that, all you need is a year, depending on the school. Navy for 16 years. Thank you for your service. Thank you for your support. I appreciate that. VA nurses have a solid, steady job with great benefits for those looking for that sort of thing. You are 100% correct. They do. The VA is just very, very hard to get into, and it is a long process. Do you know any psych MPs? Do they like their job? I thought about joining the military after I graduated. Put it this way: if you join the military after you graduate, just try it. Just try it and see if you like it. It's a very big change, but you never know. You might like it. I do know two psych nurse practitioners right off the top of my head. One of them I was deployed with, and the other one I was stationed with in Florida. She actually just became a psych MP, and the other one's been a psych MP for a while. So shout out to all 32 of y'all up in here. I could have swore I said I was going to go away, but here we are once again. Y'all are fucking holding me hostage and shit. How old is too old to join nursing? It doesn't matter. There is no age. I've seen people in their 50s that I was in school with that were becoming nurses. So, Kevin, have you ever known U.S. educated nurses that go work overseas, the EU specifically? I don't, Rachel. I actually haven't. That's a solid question. But I don't know that. I actually might look that up. That's actually something I'm going to look up. I'm starting in the peds ER. Okay. Eventually, I want to be a pediatric nurse practitioner. Sir, that is exactly where you need to be. That is exactly where you need to be. Or you can go work in the pediatrics clinic, right? Or you can work in a pediatric ICU. Just get all the peds, Michael. Get all the peds you can. I know. Leave. JK, stay if you want. Oh, my God. Shout out to y'all. Shout out to y'all for rocking with me. I'm glad you guys like those questions, as well as, everything that we have coming up. I appreciate it. I like to think of this as like this is like nursing, but just a different level of nursing, like family wise. I fucks with this. If you guys don't like me cursing, I'm sorry. Blame the Navy side of me. But I'm working on it. We'll get better. And if you take my course, my 7-day NCLEX course, I don't curse in there because we keep that professional, right? I have Portuguese citizenship, so I'm curious about working internationally. That's a good question. I would think that with you being here in the United States, because the United States is like the premier level of nursing for the entire world. Like, people come here to get their nursing license. So, but I'll do some research on that. That's actually unless you decide that you want to go through an international travel agency, Rachel, you can check that out and see. I heard Dubai is hiring. So anywhere in the United Arab Emirates, like Dubai, Bahrain, Kuwait, Qatar, what else is there? Saudi Arabia, they pay good and it's tax free. I'm just saying. It's a lot harder to get hired in a peds clinic. I might try and get into the NICU. Yeah, get into any peds aspect, because as long as you surround yourself with your target demographic of patients that you want when you apply for nurse practitioner school, They're going to ask you like, hey, because they're going to want references from your manager. They're going to want personal statements. They're going to want all that jazz. So definitely start if that's where you want, definitely look into those. So, but all right, y'all. Shout out to all 30 something of y'all that are in here, wanting to do paramedic. You're wanting to do it or you're going to do it. It's you do or you do not. There is no try. Right? Dubai night. Okay, definitely gonna do it. That's what I like to hear. Okay, Kev, time to go. You got me procrastinating too. Okay, all right. Rachel said it's time to go, y'all, so I got to go. No, I really do have to go. But I'll leave you guys this one thing. Be kind to yourself. Be kind to yourself all the time. Like seriously, you only got one life. You only got one life. Don't let the aspects of nursing and all the other trash in the fucking world just be kind to yourself. Take it one day at a time, one step at a time. I did. You're talking to somebody who fails fast forward often, all the time. All right. And so yeah, just be kind to yourself. I will see everybody on Friday, same time, 5:30. And we'll see what else I can come up with. We'll see if I can get some questions going or something like that. But like I said, you guys be great. Be kind to each other. Be kind to yourself. And I will see you on Friday. Peace.